ये किसको खुलाई?
Hey, Thane. I can't hear you. I don't know what's the issue here. 1 second.
Can you hear me now?
Yeah.
Okay, perfect. Great. So we can just get started now. So a big hello, everyone. Welcome to the final day of Avalamb, day 6. So we've been doing these webinars now for the whole week. And this is our last day. So we are really glad that you're all here with us. I'm going to give you a little bit of an introduction about SHARP NGO, and I'm going to tell you a little bit about Avalamb as well. And then we are going to introduce our panelists for the day and get into the conversation. So friends, SHARP NGO, SHARP stands for School Health Annual Report Program. It's a pan-India NGO working in the field of holistic development and healthcare for school-aged children and students for the past 22 years. And Avalamb, which means support, is a gamut of 24 virtual sessions spread over these past 6 days that we've been conducting to extend support to everyone tuning in from all over the country as we make it through this time of crisis. So every day from 2 p.m. to 6 p.m. each day this week. And I don't need to tell our audiences this because they have been tuning in with us every day of this week. But for those who have just joined in on this Saturday, this week from 2 p.m. to 6 p.m. each day, we have had a curated panel of healthcare workers, psychologists, doctors, RJs, influencers, artists, musicians, you name it. And the idea is that they are here to extend resources that they have to the community. So that could be authentic information about the pandemic and how to manage and how to get through the time of crisis. Nutritionists have come on and offered advice about how to eat well to boost your immunity. And we've also had artists and musicians come and share some of their healing powers, as I like to call them, by sharing their art. So today we have an exciting panel planned for you all. And just to also give you some context, the panel is bilingual. हम हिंदी और अंग्रेजी दोनों में बात करेंगे because पूरे कंट्री से बहुत जगहों से लोग हमारे साथ ज्वाइन हो रहे हैं, तो we want to be as accessible and as inclusive as possible. तो फ्रेंड्स, जस्ट इससे बिफोर आई गो इनटू दिस थोड़ा सा कॉन्टेक्स्ट देना चाहूंगी कि ये पैनल का टॉपिक हमने कैसे चूज करा, एंड देन इंट्रोड्यूस आवर गेस्ट फॉर द डे. सो यंग पीपल, जैसा कि हम जानते हैं, हमारा एक सेशन भी हुआ था थर्सडे को वेयर वी टॉक्ड अबाउट द इफेक्ट ऑफ द पैंडेमिक ऑन यूथ एंड एडोलेसेंट्स. दे हैव बीन वन ऑफ द हार्डेस्ट हिट पॉपुलेशंस इन द पैंडेमिक. हम जानते हैं कि वो कई दिन, 1 साल से अपने घर में बंद हैं, एंड यूजुअली दिस इज द एज ग्रुप जब लोग बाहर जाते हैं, सोशलाइज करते हैं. ये फॉर्मेटिव और ट्रांसफॉर्मेटिव ईयर्स होते हैं फॉर अ लॉट ऑफ पीपल. So on Thursday, we were with the psychologist, Dr. Roma Kumar, who works very closely with this population. And she mentioned that she is obviously seeing young people being hard hit by the crisis, but she's also seeing them being very adept and flexible. She said, for example, in one of the, sorry, somebody is unmuted. If you could just mute yourself on the panel. Yeah, thank you. All right. So one of the things she mentioned, for example, was she saw 24-year-olds giving tuition for the first time. And she also saw some of her clients go on to Instagram and become influencers. So there was this, obviously there's a spirit of like, hamare sath ye hua hai, young people are going through this crisis. But there's also this spirit of hope and flexibility and determination to actually get through this time by doing something creative and innovative. और इस चीज में एंटरप्रेन्योरशिप का बहुत बड़ा रोल है. एंटरप्रेन्योरशिप रियली इज एट द हार्ट ऑफ दिस कॉन्वर्सेशन बिकॉज एंटरप्रेन्योर क्या करता है जब कोई प्रॉब्लम आती है या उनको लगता है कि सोसाइटी में एक प्रॉब्लम है, तो वो उसका एक समाधान निकालते हैं, एक सोल्यूशन निकालते हैं और फिर उसको स्केल करके एक बिजनेस बनाते हैं. तो अगर हम ऐसे सोचें कि हम अपनी लाइफ के एंटरप्रेन्योर हैं, तो हम ऐसा क्या कर सकते हैं जब हमें दिख रहा है कि एक प्रॉब्लम हमारी लाइफ में आई है, तो हाउ डू वी गेट थ्रू इट बाय बीइंग क्रिएटिव एंड एंटरप्रेन्योरियल इन आवर ओन लाइव्स. तो इस कॉन्वर्सेशन को बढ़ाते हुए we have invited our next panelist, Mr. Raghav Ramatia, who is very much a champion of innovation and entrepreneurship. I'm going to give a little bit of his introduction, and we'll get into his story and sort of what he's seeing and how he can motivate young people to make the best out of this opportunity in the pandemic. So Raghav, I'm going to introduce you now. Raghav is an aspiring urban technologist who is interested in exploring how design can help us make technology more accessible with the end goal of improving the sustainability outcomes in our cities. His interest in urban issues was strengthened after experiencing the drastic worsening air quality in Delhi NCR over the years and associated health risk on residents. Raghav is a strong advocate for entrepreneurship and believes that more young people need to unapologetically pursue their ideas to accelerate the pace at which we can solve the many complex global challenges our generation faces today. तो इवन दो हमारे ऊपर ये पैंडेमिक में इतना बड़ा लोड आया है ऑन यंग पीपल, जो चैलेंजेस हमारी वर्ल्ड फेस कर रही है, दे हैव नॉट चेंज, वो बढ़ते ही जा रहे हैं. तो जितने यंग लोग एंटरप्रेन्योरशिप में आएंगे और दे विल टेक चार्ज विल बी बेटर. So Raghav, I just want to welcome you to the panel first. Any initial thoughts that you might have, feel free to go ahead and share them, and then we'll get into the questions.
Yeah, thank you so much for that introduction. I think this initiative is really inspiring in many ways to bring together a community so that we can share resources and thoughts. And I think this itself is a great example of entrepreneurship. Yeah.
Thank you so much. Thank you so much. I think, like you rightly said, the SHARP team has put together this host of webinars, these webinar marathons, as we're calling them, because we really felt that it was a need in the community. आजकल news वगैरह की जगह अगर लोग ऐसे panels में tune in करें, I feel they will feel more inspired and more equipped to deal with the kind of mental and physical toil that they're going through right now. So thank you so much for acknowledging that. And also want to acknowledge, thank you so much also for staying up late. Raghav is tuning in from Vancouver, so it is quite late there. So we really appreciate the time that you're taking out to be with us today. And all the other panelists as well. We are so inspired to see the response. क्योंकि हम ये तब तक नहीं कर सकते जब तक panelists का enthusiasm नहीं आता है and they are not as excited to be on. So we'll just get into the first question, Raghav. How do you think this pandemic has affected young people, largely speaking, our age group or even younger?
Definitely. I think one of the biggest impacts जो pandemic का हुआ है young people पे, I think a lot of the young people, there's a certain outlook that they have on the world कि this is the time जब सब लोग सोच रहे हैं कि what will be my impact on the world? मतलब मेरी position क्या होगी? There are some people who are trying to pursue careers like becoming doctors and engineers, which are more professional careers, but then we also know that at the pace which technology is increasing, or at the pace which the job market is kind of like evolving, there's already so much uncertainty about future की jobs क्या होंगी आज से 5 साल बाद भी. And I think that has accelerated a lot for young people, because now in addition to worrying about technology ka impact unki future pe, they also have to worry about what will be the impact of COVID. Mm-hmm. And I think especially for people who don't necessarily come from a background in technology, so to say. So the way the curriculum is structured in India, we can call them like more people who come from like a non-science background. I think for those people especially, like I came from a background in commerce, and I kind of made my way through understanding, okay, like how can technology work with these, how can you connect these pieces? But I think for a lot of people, those resources don't exist. So I think the biggest challenge that has happened for young people is that the gap between the information gap between what will happen in the job market and what is kind of their position right now has increased drastically.
Right. That's so interesting that you share that, because in some ways we also live in this time of informational overload, but despite that, it is a time of great uncertainty. So like you said, a lot of folks may not have the resources to equip themselves to be able to come to terms with that. So what are some of the things that you think young people can do to overcome that or surmount that in some way?
Definitely. And I think to surmount that, there's two things that I think can be really helpful. One is to actively, build a network and reaching out to that network to get a sense, not necessarily only when, you need a job or like when you are looking for a job, I think constantly reaching out to people and getting a sense of like, what is happening, उनकी कंपनी में क्या क्या हो रहा है. Just जो for example हमारे जिस कंपनी में मैं भी काम कर रहा हूँ वहाँ पे they're looking for like a role called community success. And if you think about it, like आज से 5 साल पहले मैंने कभी नहीं सोचा होगा कि community success नाम का भी कोई रोल होगा जहाँ पे इस इंडिविजुअल की जॉब होगी कि वो सिर्फ कम्युनिटी बिल्ड करे कंपनी के अंदर और कंपनी के बाहर भी. क्योंकि अब काफी जो कंपनीज आ रही हैं उसमें मार्केट प्लेस टाइप कंपनीज हैं जो दो मार्केट्स को कनेक्ट करती हैं. हमने देखा एयरबीएनबी है, हमने देखा जो आगे काफी सारी कंपनीज आ रही हैं इस टाइप की. सो एक चीज जो यंग लोग कर सकते हैं वो एक्टिवली अपने नेटवर्क को रीच आउट करें और उनसे समझें कि क्या हो रहा है इंडस्ट्री में और उनकी कंपनी में किस टाइप के नए रोल आ रहे हैं ताकि उसका वो एक सेंस they can get a sense of that. I think the other piece is being more proactive. So specifically talking about entrepreneurship. तो आजकल जो नए स्टार्टअप्स आ रहे हैं 80 to 90% of the jobs ये स्टार्टअप्स कभी पोस्ट नहीं करते. बट हमें पता है कि there are forums online, जैसे कि there is a forum where you can find all the funding that these startups have raised. So you can go on forums like that. You can look at startups just किसने कितनी फंडिंग रेज करी है. इंडिया में जैसे मैं फॉलो करता हूँ, हम स्टार्टअप इंडिया है और just there's योर स्टोरी इंडिया है. वो लोग काफी सारे आर्टिकल्स पोस्ट करते रहते हैं. सो आप आर्टिकल देखें और उसमें देखें कि आपकी जिस इंडस्ट्री में आपको इंटरेस्ट है उसमें किस टाइप के स्टार्टअप्स पैसे मनी रेज कर रहे हैं, वीसी फंड्स रेज कर रहे हैं. और आप प्रोएक्टिवली उनको रीच आउट करें कि आप देखें कि अच्छा इन्होंने फंड्स रेज किए हैं तो दे प्रोबेबली आर लुकिंग टू हायर पीपल. आई थिंक दैट्स मोर स्ट्रेटेजिक. और आप अलाइन करें कि अगर आपने अंडर ग्रेजुएट में अपनी बीकॉम करी है तो आप कंपनी को डायरेक्टली रीच आउट करें क्योंकि छोटी कंपनीज के पास काफी टाइम रिसोर्सेज नहीं होते एक पूरा हायरिंग प्रोसेस मैनेज करने के लिए. तो इवन इफ यू डोंट क्वालिफाई फॉर लाइक अ सर्टेन जॉब जो उनकी कंपनी में लिस्टेड है, आपको वो हमेशा याद रखेंगे क्योंकि आप प्रोएक्टिव थे, आपने देखा कि आपको इंटरेस्ट है. सो आई थिंक दीज टू थिंग्स कैन रियली हेल्प इन getting an edge in the job market in the world today.
Right. Thank you for sharing that. And why do you think कि जैसे कई लोगों का ये एक वो होता है कि कॉर्पोरेट जॉब्स या फिर जो स्टैंडर्ड जॉब्स की तरफ जाना चाहते हैं, तो इज देयर अ पुल दैट यू फील कि स्टार्टअप्स की तरफ एक है, एंड व्हाई वुड यू से दैट, व्हाई वुड यू एनकरेज यंग पीपल टू काइंड ऑफ गो फॉर दोस टाइप्स ऑफ थिंग्स इंस्टेड, if at all?
Definitely. I think startups are a very unique time. I think especially during a pandemic, working at two startups, you get to work very closely with founders. आप जब देखते हो कि daily basis पे आपका जो touch point है वो founders के साथ वो बहुत high रहता है. तो आप देखते हो कि founders कैसे सोच रहे हैं, adapt कर रहे हैं companies को, और आप ये देखते हैं कि जो आपको बिकॉज आप उनसे इतनी आप उनसे डेली बेसिस पे बात कर रहे हैं तो आपको देखने को मिलता है कि वो कैसे सोच रहे हैं, वो कैसे जो इन्फॉर्मेशन आ रही है उसको कैसे प्रोसेस कर रहे हैं. और आई थिंक वो काफ़ी इंटरेस्टिंग चीज़ है. और आई थिंक स्टार्टअप्स में यू कैन ऑल्सो एक्सपीरियंस हाइपर ग्रोथ. जैसे जिस स्टार्टअप में अभी काम कर रहा हूँ मैंने कंपनी ज्वाइन करी थी जब 12 लोग थे, अब वहाँ पे अराउंड 35 लोग हैं. तो आप ये भी देखते हो कि कैसे एक अगर आपको डाउन द लाइन खुद कंपनी शुरू करना चाहते हैं तो आपको देखने को मिलता है कि कैसे वो स्केलिंग प्रोसेस होता है. जो मेरे ओपिनियन में द स्केलिंग प्रोसेस इज अ लॉट हार्डर देन स्टार्टिंग समथिंग. क्योंकि आजकल हमारे पास जैसे एज यू मेंशन देयर इज अ लॉट ऑफ इंफॉर्मेशन आउट देयर टू स्टार्ट अ कंपनी एंड देयर आर लॉट ऑफ रिसोर्सेज. इट्स वेरी चीप टू स्टार्ट अ कंपनी टुडे, बट उस कंपनी को स्केल करना इज द रियल चैलेंज. तो अगर आप स्टार्टअप में यंग एज पे काम करते हैं तो आपको देखने को मिलता है कि कैसे हम 0 to 1 नहीं पर 1 to 100 कैसे जा सकते हैं. और आई थिंक वो जो लेसन है उसमें काफी चीजें होती हैं जो there a lot of them are soft skills. तो आपको वो सीखने को मिलती है इस यंग एज पे.
Right. Thank you for sharing that. Or on that note, also, I'd like to sort of ask you a little bit about connecting this with the pandemic. this is also a time where we are seeing so many problems emerge in the world. तो entrepreneurs के लिए भी एक challenge है कि pandemic से related जो problem society में वो देख रहे हैं उनको वो कैसे solution provide कर सकते हैं. So what are you seeing in your industry as an entrepreneur, as a champion of innovation? What are you seeing? What are the conversations like? Entrepreneurs कैसे सोच रहे हैं कि ये जो crisis आया है, how to use that and how to spin it into an opportunity? कि पूरे world में सब लोग affect हुए हैं इससे, लेकिन जो entrepreneurs हैं वो इसका solution कैसे ढूंढ रहे हैं और कैसी कैसी companies बन रही हैं इस time पे?
Definitely. So I think, as always, entrepreneurs have been really innovative. So I think a lot of entrepreneurs have realized that they cannot now work in isolation. कि usually a lot of times, especially पिछले 10 सालों में हम जब entrepreneurship के बारे में सोचते हैं तो एक उसमें sense of competitiveness होती है कि कैसे हम you know हम इस इंडस्ट्री में सबसे बेस्ट कंपनी बनना चाहते हैं तो हमें दूसरी कंपनी को we have to उनसे आगे बढ़ना है. बट उसमें एक टाइप की नेगेटिविटी थी. बट आई थिंक कोविड में व्हाट कोविड हैज डन इज कि उन्होंने उस चीज को काफी हद तक कम कर दिया है. और इट्स लाइक रियली कंपनी उन्होंने काफी कंपनीज को सोचने में मजबूर किया कि हमारी वैल्यू क्या है, हम क्या वैल्यू एडिशन कर रहे हैं और इस वैल्यू एडिशन को हम कैसे मैक्सिमाइज कर सकते हैं बाय कोलैबोरेटिंग विद अदर कंपनीज. सो फॉर एग्जांपल आजकल काफी accelerators are in, which are these programs that can you can just join the program and then they take you through this journey. There's like minimal commitment. So I can share one with the am I able to share something with the entire audience?
Share screen.
Oh, I can share my screen. Okay. So
are you able to do that?
Yeah.
Okay, perfect.
So for example, जैसे आप अगर Google करेंगे Join EF Entrepreneur First, they have a program in Bangalore as well. So essentially what इस program में क्या होता है कि you can apply as an individual. आपको कोई company का idea नहीं चाहिए और आपको कोई background नहीं चाहिए. You just apply and based on your potential, they'll accept you. They'll give you a stipend. So जैसे आप देख सकते हैं कि they have different cohorts. इनकी application अभी खुली हुई है बैंगलोर के लिए और काफी interesting startups इससे आते हैं. So for example, one of the companies that came out is called Omnipresent. So Omnipresent now allows it is tackling the challenge of like working remotely. So अगर आपके पास मान लो कि आपके पास दूसरी country में work permit नहीं है, but they can make sure कि you can get hired regardless of that bureaucratic challenge that many people face. For example, for me, I'm living in Canada right now. I'm working for this company based in the UK, but I don't have a work permit there, but like working through this company. And this company came around last year, around 2020, 2019. So that's just one example कि जैसे COVID की वजह से अब सब remote work कर रहे हैं तो more and more companies can now access a larger pool of talent in other countries regardless of race or any sort of bias or where you were born. So this is just one example. और अगर आप इस कंपनी इस वेबसाइट पे एक्सप्लोर करें तो यहाँ पे काफी एग्जांपल्स हैं और स्पेशली इंडिया स्पेसिफिक एग्जांपल्स भी हैं कि किस टाइप की कंपनीज आई हैं. The other thing I've seen, there's this really interesting thing that almost like a revolution happening in India, which is around kind of industrial engineering. So grassroots levels पे हम कैसे products बना सकते हैं. So I'll just look that up and I'll share the link with you. One second.
What I'm gathering also is that ऐसे अगर हम बैठ के सोचें कि ये जो क्राइसिस हुआ है इससे कौन से इंडस्ट्रीज अफेक्ट हुई हैं और कौन से इंडस्ट्रीज में नए अपॉर्चुनिटीज बने. जैसे आपने लेबर मार्केट के बारे में बात करी कि लेबर मार्केट के अंदर ऐसा हो रहा है कि नाउ यू कैन वर्क रिमोटली, यू कैन वर्क फ्रॉम एनीवेयर इन द वर्ल्ड. तो जो वो ब्यूरोक्रेटिक चैलेंजेस को से कैसे बचना है और उनको कैसे लूपहोल्स को मतलब उनसे प्रॉपरली लीगली चीजों को करना है, उसकी डिमांड बढ़ गई है एकदम से. मोर कंपनीज आर इंटरेस्टेड इन दैट. तो जैसे ये कंपनी ने उस चैलेंज को सरमाउंट करा. And on that note, even your company that you're currently working for has been is a direct descendant of this pandemic in some way. So feel free to also talk about that a little bit. How did that happen? And even like how you got involved in it, because it's quite an interesting thing that you're working in another country and your company is in another country.
Yeah, definitely. So the company I'm working for right now, it's called Hago. So I'm actually more than happy. So there's actually, I can share my screen and show you what exactly that is. So essentially on Hago, if you go to hago.com, you can join any free virtual tours of different places in the city. And it really came from my interest in thinking about like technology and urban planning. And so in this case, what you can see is that all these tours are hosted by locals. We also have tours in India, and we're now I'm leading an experiment where we're experimenting Hindi language tours. So वो काफी interesting रहेगा. But let me see if this tour is already live, and we can all kind of go to London together for the time being. Yeah, the host is still joining, but this is just one example. So इस company में, for example, जो founders थे, उन्होंने last June में they founded the company where they saw कि there's this knack for travel that people have, but people are not able to kind of travel in these difficult times. तो कैसे हम वो traveling के दो aspect होते हैं. एक होता है कि हम gather होते हैं साथ में, और but the other aspect is storytelling. We all humans are very curious. So to cater to that aspect, you can just like go now and hear perspectives from different people around the world, get to know like what is their life like, and engage with them. And there's like amazing communities that are forming online, which is really amazing to see. And the organization that I was going to talk about is called Makers Asylum. I think it's an amazing organization that's that has been doing amazing work over the past 5 or 6 years. The person who founded Makers Asylum, I believe, they were previously at MIT, and then they developed this product which is called Netra. It really helped a lot of hospitals in rural India to do like eye testing and stuff. But right now, the recent project they're leading it's called the COVID-19 oxygen kit. So essentially, it's like this distributed kit, and they're training people to make their own kits. So you just have like the parts coming out, and then you can train the local people to like assemble these kits and kind of just like meet the demand of the oxygen in these places. And I think that's one amazing example of where entrepreneurship and innovation and technology comes together to solve problems that are very immediate in our communities.
Right. On that note, if anyone has questions, please feel free to drop them in the Q&A box. We will be taking those as well. और जो best question होता है, जिसको हम कहते हैं the sharpest question of the session, gets a 500 rupee award at the end of Amazon voucher at the end of the day. तो 6 बजे वो winners भी announce होंगे. So please feel to ask your questions about entrepreneurship, about how young people can step up in this time, and sorry, how there is some disturbance, sorry. So how young people can step up in this time. And sorry, just one moment. All right, can step up in this time. So please feel to send in your questions as well. So I would also like to ask you, Raghav, like in terms of like your experience, like how did we are talking about also all these high level concepts too, but in your personal life as well, like how was that journey of like being a young person in the pandemic? Then how did you use the opportunities that were around you? जैसे you talked about networks को बनाएं और फिर उनको use करें और उनसे touch में रहें, to be sort of equipped to deal with such type of crises. So can you share a little bit also about your personal experience as an entrepreneur, as a young person in this time?
Definitely. I think entrepreneurship in general is known to be like it can be a very lonely journey, a lot of the time, especially if you're the only founder. So, in मेरे case में, I think what I looked at it as almost like priming myself for that down the line. So I think when you get to spend a lot of time, in quarantine by yourself, when you don't have a lot of, your friends or like that socialization, I think every kind of aspiring entrepreneur leader kind of goes through three steps of, you can call it maturity, or you can call it three steps of growth. I think the first one is really like आपको एक कंटेम्प्ट होता है कि जो दुनिया में हो रहा है ये गलत है, और ये मतलब ये बहुत बुरा हो रहा है. आई थिंक आप उसको देखते हो, आपको काफी गुस्सा आता है. आई थिंक सेकंड स्टेप होता है कि आप रिकग्नाइज करते हो कि आपके पास लिमिटेड टाइम है और लिमिटेड रिसोर्सेज हैं, तो आप अपनी लाइफ टाइम में प्रॉबेबली दुनिया बदल नहीं सकते पूरी. और उसका थर्ड स्टेप होता है कि आप सोचते आपको इज द रियलाइजेशन कि आपको ऑलमोस्ट एक ग्रेटिट्यूड होता है कि आपके पास ये इतने रिसोर्सेज और इतना प्रिविलेज है कि आप दूसरे लोगों के लिए प्रॉब्लम सॉल्व कर सकते हो. सो आई थिंक pandemic में for me these three things kind of moving along these stages became very clear कि कैसे I'm thinking, I think जब pandemic अभी, and I think not to say like the pandemic has ended, it's very much here, but हम देखते हैं कि काफी हमें लगता है कि होप चली जाती है, और हमें लगता है कि अब मतलब काफी लोग कंटेम्प्ट स्टेज में हैं. but I think as soon as we can move more towards कि हम उस gratitude stage पे कैसे पहुंचे, कि हमें लगे कि I'm like so thankful कि I'm able to help other people, and I have the networks and the ability, or even the opportunity, the education to do so in some capacity. And I think that was the biggest kind of like high level change. I think talking specifically about networking, I started kind of reaching out to people, and just having like 30-minute chats. So it's very easy to do. You just like you can create like a calendar for yourself. There's tools like Calendly. तो आप उस कैलेंडर को बनाओ, और आप लिंक्डइन पे लोगों को मैसेज डाल दो कि मेरे को आपसे बात करने में इंटरेस्ट है, और ये मेरा कैलेंडर है, आप इसमें 30 मिनट्स बुक कर सकते हो. अगर आप उस कॉन्वर्सेशन को थोड़ा स्ट्रक्चर करो, तो आप सरप्राइज हो जाओगे कि आपको कितने लोग आपको रीच आउट करेंगे. सो आई थिंक अंडरस्टैंडिंग कि प्रोफेशनल लोग कैसे सोचते हैं और उसको कैसे अप्रोच करो, आई थिंक दैट्स ऑल्सो वेरी इंपॉर्टेंट. So I think those were two things that kind of I personally did during the pandemic. And of course, I think you're learning new skills. जैसे मेरे को एक product management जो मेरे को सीखने को मिला कि एक नई चीज आ रही है in this industry. तो मैंने देखा कि उसमें क्या skills चाहिए, तो थोड़ी data analytics skills चाहिए होती है, तो मैंने थोड़ा वो pick up किया, और बाकी थोड़ा design skills pick up किया. But कोई आपकी industry में जो भी relevant skills हैं, आप वो थोड़ा pick up कर सकते हो. And all of these are free online. There's Code Academy. There's millions of resources online that you can access them through.
Right. Thank you. And I hope जो लोग सुन रहे हैं, they can make use of those resources, and they are feel energized to make use of those resources as well. So on that note, I'd just like to start maybe taking in the audience questions. So the first one we have Kuwar Bahadur Singh. I will ask you to unmute yourself and ask your question, please. You can tell us where you're calling in from, and unmute yourself and please ask your question. Can you hear me, Kuwar Singh? कुंवर जी, आपको अगर सुनाई दे रही आवाज, आप प्लीज अनम्यूट करिए और अपना क्वेश्चन पूछिए. Till we wait for that, there's actually an anonymous attendee who messaged on the chat and said that if anyone would want to reach out, would you be like interested in assisting and guiding? I'm amazed with your knowledge on startups. This is for you, Raghav, I think.
Yes, definitely. You can reach me on LinkedIn, or yeah, LinkedIn is the best place.
All right. Perfect. Well, if Kuwarji agar nahi pooch raha apna question, so we can go on to our next question. Mariam, if you can, I'll ask you to unmute yourself and feel free to ask your question, Mariam, and tell us where you're calling in from as well, please.
Hello, ma'am. Hello, sir.
Hi.
Myself, Mariam Baby from Andaman Nicobar Island.
Wonderful. Please ask your question, Mariam.
Yeah, actually, I have a question that because during pandemic, we have seen that actually women have started lot of business. They have started become entrepreneur by their skill. Just like they used to prepare the food and they used to give it to the people who ask for it, take away home like that, cakes and all. Because of this pandemic, many people, especially the ladies, have started to make the creativity is there by seeing the YouTube and all. And some other online shoppings were there, so that they will purchase the dress materials or the toys or something, and they will give to them. But because of this pandemic, all these business are now standstill. So because already don't have, the women don't have that investment, much more they have to invest. they उनकी जो जमा पूंजी से थोड़ा पैसा बचा के वो बिजनेस करते हैं, और जब उनका बिजनेस रुक जाता है स्टार्टिंग में ही थोड़ा रुकावट आ जाती है, तो उनको मोटिवेशन खत्म हो जाता है और दोबारा वो करने के लिए हिम्मत नहीं कर पाती, क्योंकि उनके फैमिली से सपोर्ट नहीं मिलता। तो उस तरह लेडीज कैसे अपने बिजनेस को आगे चला पाएगी? बिकॉज मैंने बहुत लेडीज को देखा है जो बहुत अच्छा स्टार्ट किया था उन्होंने, लेकिन पैंडेमिक की वजह से उनको बहुत नुकसान हो गया, उनके बहुत सारे माल रुक गया, ऑर्डर कर दिया था, या उन्होंने जो जैसा उनका करना चाहते तो कर नहीं पा रहे। तो ऐसा में राघव सर, हम क्या उनको आप क्या सजेस्ट करना चाहेंगे कि वो अपना मोटिवेशन को हाई करे और अपना बिजनेस स्टार्टअप और अच्छा से कर सके? थैंक यू।
बिल्कुल। तो आई थिंक जो इशू आप रेज कर रहे हैं वो काफ़ी रेलेवेंट है, और इसके अलोंग मैं लिंक्डइन पे काफ़ी 2-3 लोग हैं जिनको मैं फॉलो करता हूँ, और इंडिया में काफ़ी एक्चुअली विमेन स्पेसिफिक फंड्स आ रहे हैं जो आपको सीड फंडिंग में हेल्प कर सकते हैं। तो एक ऑर्गेनाइजेशन है जैसे कलारी कैपिटल जो बैंगलोर में बेस्ड हैं, वो काफ़ी वानी, आई थिंक मैं फाउंडर का नाम भूल रहा हूँ, बट वो काफ़ी सपोर्टिव हैं। तो वो जैसे लाइट स्पीड इंडिया वेंचर्स एक काफ़ी फेमस वीसी फंड है, वो लोग सिर्फ वुमेन स्पेसिफिक फंड कंपनीज में इन्वेस्ट करते हैं। और ये इन्वेस्टमेंट ज़रूरी नहीं है कि आपकी काफ़ी आपकी कंपनी बड़ी होनी चाहिए, वो सीड स्टेज इन्वेस्टमेंट भी करते हैं, तो इनिशियल स्टेजेस पे। तो मैं आपको इस केस में मैं मोटिवेट आपको बोलूँगा कि आप विमेन स्पेसिफिक फंड्स को थोड़ा लुक आउट करें, और कुछ कलारी कैपिटल इज अ गुड प्लेस टू स्टार्ट कि आप देखें जो वानी कोला हुज द फाउंडर, वो काफ़ी रिसोर्सेज शेयर करती हैं अपने लिंक्डइन पे, तो आप उनको ट्विटर और लिंक्डइन पे फॉलो करें। आप वो देखें कि कैसे वो एक विमेन के लिए शी इज काइंड ऑफ शेयरिंग रिसोर्सेज। तो आई थिंक दैट्स अ गुड स्टार्टिंग पॉइंट।
अच्छा, तो उनका लिंक कुछ मिल सकता है सर?
हाँ, तो मैंने चैट में उनका कंपनी का डाल दिया है, बट मैं आई विल शेयर द स्पेसिफिक लिंक्स एज वेल।
अच्छा, www.kalari.com।
या बट आई वुड से लिंक्डइन पे उनको आप फॉलो करें। वानी कोला उनका नाम है। उनका मैं विकिपीडिया आपके साथ शेयर कर देता हूँ। तो वो काफ़ी she's like definitely one of the pioneers for women entrepreneurship in India.
थैंक यू सो मच सर। ऐसे ही हम लोग को चाहिए जो मतलब ऐसा हेल्प करे इस टाइम में, उनका मोरल बूस्ट करे। थैंक यू सो मच सर। थैंक यू तानिया मैम।
Thank you, Mariam. Next question we have Shweta Singh. If you can unmute yourself, आप बताइए आप कहाँ से कॉल कर रही हैं, अपना क्वेश्चन पूछिए प्लीज। Shweta, if you can hear me, please unmute yourself and ask your question. All right. In that case, I'll just read out her question because I think it's quite interesting. She says, as a common entrepreneur, how one can be very confident to overcome all these different kinds of legalities to follow up at the context of different geographical areas or countries? Is there a single window of such kind, like a help desk or some kind of apex body that is available? So I think more on the side of like entrepreneurship and how to sort of reconcile with the legalities और वो जो logistics आते हैं और जो भी trade marketing copywriting, I think उस type का question वो पूछ रही हैं आप.
या आई थिंक अगर आप ऐसी किसी इंडस्ट्री में जा रहे हैं जहाँ पे लीगल एस्पेक्ट्स काफ़ी मायने रखते हैं, तो आप आई थिंक ज्वाइनिंग वन ऑफ दीज इंक्यूबेटर्स और एक्सेलरेटर्स इज़ अ ग्रेट प्लेस टू स्टार्ट, क्योंकि इनके पास काफ़ी रिसोर्सेज होते हैं. सो अगर आप गूगल करें, टेक स्टार्स से लेकर हमारे काफ़ी ग्लोबल लेवल के जो एक्सेलरेटर्स और इंक्यूबेटर्स हैं वो इंडिया में एग्जिस्ट करते हैं, और हमारे काफ़ी इंडिया स्पेसिफिक इंडियन जो एक्सेलरेटर्स इंक्यूबेटर्स जो इंडियंस ने स्टार्ट किए हैं वो भी एग्जिस्ट करते हैं. तो जैसे कि आज की डेट में जो फ्लिपकार्ट के फाउंडर्स थे उन्होंने एक्सेलरेटर और इंक्यूबेटर स्टार्ट किया है. तो अगर जस्ट गूगल करें इंक्यूबेटर एक्सेलरेटर इंडिया और अपनी इंडस्ट्री गूगल करें, तो आपको ये काफ़ी इंक्यूबेटर्स मिल जाएंगे. जैसे मैंने जो शेयर किया था जॉइन EF, मैं लिंक डाल देता हूँ. ये काफ़ी अच्छी जगह है जहाँ से आप शुरू कर सकते हैं, क्योंकि इनके पास पूरी टीम्स होती हैं फॉर लॉयर्स एंड स्पेशलिस्ट टू सपोर्ट यू, और ये आपको काफ़ी टाइम से एक टाइप से फंडिंग भी दे देंगे. तो आई वुड से कि दिस इज लाइक ज्वाइनिंग वन ऑफ दीज प्रोग्राम्स इज द बेस्ट प्लेस टू स्टार्ट, क्योंकि आपको वो सारे रिसोर्सेज एक टाइप से पूल करके मिल जाते हैं और एक स्ट्रक्चर्ड वे में मिल जाते हैं.
Great, thank you for that, Raghav. The next question is by Khubi. If you can unmute yourself and please ask your question. Khubi, if you can please unmute yourself, you can hear me. Just unmute yourself. अपना share बताइए और अपना question पूछ सकते हैं आप.
Yes, hello ma'am, hello sir.
Hi.
Hello, can you
We can
hear
hear
me, sir?
you. Yeah, we can hear you. You can ask your question. Tell us where you're calling in from. Introduce yourself. Whatever you want. Floor is yours.
Yes, I am calling from Faridabad, ma'am, Haryana. And my question
Wonderful.
was, as a lot of people are losing jobs nowadays in the times of pandemic, and they have no source of income, and we are also seeing that they are facing unprecedented problems also. So what should they do? What can they do? And as they have just moderate qualifications also, so is there any hope for them? Is there any opportunity they can avail themselves in these times? What would you like to suggest for these people, sir?
सो इस केस में आजकल जैसे कि काफ़ी सारी फ्रीलांसिंग वेबसाइट्स हैं, और फ्रीलांसिंग वेबसाइट्स का क्या जैसे फाइवर है और upwork.com है, और कुछ इंडिया स्पेसिफिक फ्रीलांसिंग वेबसाइट्स भी हैं. तो अगर आपके पास कोई भी स्किल सेट है और आपको ज़रूरी नहीं है कि आप कुछ टेक्निकल स्किल सेट हो, जैसे कि ग्राफिक डिज़ाइन से लेकर कोई भी कंसल्टेंसी, अगर आपको इंडस्ट्री में 1-2 साल का एक्सपीरियंस भी है, तो आप अपनी प्रोफाइल बना सकते हैं इन वेबसाइट्स पे, और आपको कंपनीज हायर कर सकते हैं कुछ प्रोजेक्ट्स के लिए. सो ये काफ़ी इंटरेस्टिंग वे है, क्योंकि काफ़ी टाइम लोग सोचते हैं फ्रीलांसिंग होने के लिए, आप फ्रीलांसर बनने के लिए आपको 10 साल का एक्सपीरियंस चाहिए, बट ऐसा नहीं है. आज की डेट में आप अपनी प्रोफाइल बना सकते हैं और अपने प्रोजेक्ट्स बना सकते हैं और शेयर कर सकते हैं, क्योंकि काफ़ी टाइम कंपनीज जैसे लोगों के लिए मुश्किल है, बट कंपनीज के लिए भी मुश्किल है, क्योंकि कंपनीज फुल टाइम लोग हायर नहीं कर सकती, क्योंकि तो हर एक पर्सन को पेरोल पे डालोगे अगर आप, तो एक काफ़ी बड़ी कॉस्ट होती है वो. तो आजकल कंपनीज इन वेबसाइट्स पे जा रही हैं, वो देख रहे हैं कि अगर हमें ये 3 महीने का प्रोजेक्ट है और हमें इस पे कोई स्पेसिफिक हेल्प चाहिए, तो फ्रीलांसिंग वेबसाइट्स. तो अगर गूगल करें फ्रीलांसिंग वेबसाइट्स इंडिया या फिर इंडिया स्पेसिफिक, तो आपको काफ़ी सारे रिसोर्सेज मिलेंगे जहाँ पे आपको अपॉर्चुनिटीज मिल सकती हैं, और डाउन द लाइन कई बार ये कंपनीज अगर उनको आपका काम अच्छा लगा तो वो आपको फुल टाइम जॉब भी दे सकते हैं. तो आई वुड से दैट्स अ ग्रेट प्लेस टू स्टार्ट.
Okay, sir. Thank you.
Thank you. All right, the next question we have Bani. Bani, if you can hear me, please unmute yourself and ask your question.
Hi ma'am, hi sir. So I am Bani Bakshi. I am from Chandigarh and I'm in 12th grade. So I was just about to apply to my colleges in coming months. So I wanted to ask, I want to pursue my career in culinary arts. So I was thinking maybe after doing the basic associate's degree in culinary arts, can I take up entrepreneurship in culinary world also? Like, is there some option in that which I can pursue? Maybe.
Definitely. I think one of the one of the really interesting things that is happening in the industry is that anything that come, anything that has to do with food. I think food tech is in its industry. So जैसे कि यहाँ पे वैंकूवर में मैं एक कंपनी का लिंक आपके साथ शेयर कर रहा हूँ. ये कंपनी पेंडेमिक में काफ़ी ग्रो हो गई है और इसका एप्लीकेशन इंडिया में थोड़ा डिफरेंट होगा. ये कंपनी बेसिकली क्या करती है, इनका नाम है फ्रेश प्रेप. ये लोग जो आपकी मील की डिलीवरी करते हैं, तो जो इंग्रेडिएंट्स हैं वो प्री मेजर्ड होते हैं और ये आप ऑनलाइन सिलेक्ट करते हो और आपको मील किट मिल जाती है और रेसिपी मिल जाती है. तो जैसे कि अगर हम जो आपने जो अपना प्लान डिस्क्राइब किया, अगर आपके पास वो मिनिमम क्वालिफिकेशन है तो ज़रूरी नहीं है कि आपको सिर्फ शेफ की जॉब आज से 3-4 साल बाद करनी हो. इसमें आप ये काफ़ी इनोवेटिव जॉब्स हैं. तो ये देखते हैं कि आपको डेटा मिल रहा है फ्रॉम योर कस्टमर्स और आप देख रहे हो कि क्या प्रेफरेंसेस हैं. तो आपको एक्सपेरिमेंटेशन करने का मौका मिलता है कि कैसे हम नई ऑफरिंग्स दे सकते हैं. और 5 साल में इस टाइप की सर्विस इंडिया में अगर आज नहीं है तो 5 साल में आनी ही आनी है. So I would say, like innovations like these will happen in India as well, as the markets grow and हमारी markets में थोड़ी connectivity बढ़े. So I would say this is a great example कि कैसे you can apply your skills at the intersection of food and technology down the line.
Thank you so much.
Yeah.
Thank you.
Thank you. All right. The next question we have Sujit. Sujit, please unmute yourself. Unmute करके बताइए कहाँ से आप call करें and ask your question, please.
I'm calling from Delhi, and my question is that right now we are seeing in the state that most of the states are trying to put on the lockdowns, and we are talking about new opportunities. The question is, if the lockdowns is there, that is the complete type of lockdown, people cannot move outside, that where would be the buyers then? If everything would be stopped, people cannot move out, then the new starters will not be able to survive. So and one more thing, that we can't rely entirely on the government for this, that the government will do the relaxation. So how such people can survive during this time of COVID? Because if everything is locked down, then those people may not survive because they have just started the business. So how can they face this type of situation? That is my question. Thank you.
Thank you.
Definitely. I would say कि आपके केस मतलब इस केस में it's very hard to give like a general answer क्योंकि इंडस्ट्री टू इंडस्ट्री डिपेंड करता है काफ़ी. अगर आप इंपोर्ट एक्सपोर्ट में हैं तो उसका काफ़ी डिफरेंट होगा क्योंकि उसमें बेसिकली गवर्नमेंट का काफ़ी बड़ा रोल है कि अगर शिपमेंट्स नहीं आ रही हैं तो मतलब आप ज़्यादा कुछ कर नहीं सकते अगर फ्लाइट्स बैन हो रखी हैं. बट आई गेस अगर आप थोड़ी टेक्नोलॉजी अगर इंडिविजुअल लेवल पे हैं तो जैसे जो कंपनी मैंने शेयर करी थी, कंपनी जहाँ पे मैं काम कर रहा हूँ hego.com, वहाँ पे आप अपना आप क्रिएटर बन सकते हैं. तो आप आपको चाहिए कि आपके पास एक फ़ोन हो और बस आपको अपनी शहर के बारे में पता हो. दैट्स ऑल यू नीड टू लाइक स्टार्ट मेकिंग एन इनकम ऑन दिस प्लेटफॉर्म. तो कहने का मतलब है कि इंडिविजुअल लेवल पे आप बहुत कुछ कर सकते हैं, बट अगर आप अपनी कंपनी के बारे में बात कर रहे हैं तो वो काफ़ी मतलब इंडस्ट्री स्पेसिफिक है. सो मैं कहूँगा कि मेरे को उसके बारे में काफ़ी सॉलिड नॉलेज नहीं होगी. ऑल्सो रिकग्नाइजिंग कि मैं अभी इंडिया में नहीं हूँ, तो डे टू डे मैं जितना काइंड ऑफ नॉलेज मतलब टच में रह सकता हूँ मैं रहता हूँ. But so I don't know if I'll be the best person to answer your question at this point. Yeah.
Thank you, sir. Thanks a lot. Thank you, sir.
Yeah.
Thank you, Sujit. And we also have a question from Sujata. So Sujata, if you can unmute yourself, feel free to ask a question. Tell us where you're calling in from. Sujata, if you can hear me, please unmute yourself and ask your question, please. All right. If you're not able to join, I'll just ask the question on your behalf. So Raghav, Sujata ने ये पूछा है कि how can a young architect start a company? Any guidance available on for young architects?
Definitely. I mean, I definitely don't come from an architecture background, but I do have a strong interest in the field. I think from what I know, there's like a lot of interesting companies that are coming around, which are again, as I talk, urban technology की बात करें, तो at the intersection of technology and urban issues, and I think architecture plays a big role. So जैसे I'm sure, I don't know if you have heard of this company. It's called Sidewalk Labs. अगर आप इस company की देखें तो इनकी इस वेबसाइट पे अगर आप जाएंगे तो आपको नीचे देखने को मिलेगा कि इनकी काफी पोर्टफोलियो कंपनीज हैं और उसमें से कुछ कंपनीज हैं जो सिर्फ आर्किटेक्चर काइंड ऑफ प्रॉब्लम्स सॉल्व कर रही हैं. सो देयर इज अ कंपनी दैट दे हैव they're just working on mass timber buildings. So हम कैसे लकड़ी से काफी बड़े projects बना सकते हैं, buildings बना सकते हैं. तो I'm sure you have a better kind of sense of that. But I would say kind of spend some time looking at, they also have a podcast. They also have other resources on the website. That's kind of one way. I would say agar on architecture or entrepreneurship ke beech mein, I think technology will play a big role. So I think getting a good sense of what's happening, how technology is changing architecture will be very crucial if you wanted to become an entrepreneur. क्योंकि अगर आप अपनी खुद की practice establish करना चाहते हैं आज से 5 साल में, तो और अगर आप अपने आप को differentiate करना चाहते हैं, तो I think having even like a basic understanding of technology would be very helpful, because things are, this is my opinion. I think इस industry में, built environment industry में, smart cities और ऐसे जैसे टेक्नोलॉजी का इंटीग्रेशन होता है तो काफी इंपॉर्टेंट हो जाएगा.
Thank you so much, Raghav. So folks, we do have a special announcement, and unfortunately जो अभी questions आ रहे हैं, we are no longer able to take them, but Raghav, if you're around, feel free to answer them in the chat. But I know it's also getting late for you. But thank you so much for joining us और बताने के लिए हमें कि how young people can use entrepreneurship as a way not only to take charge of their lives but also society को benefit कैसे कर सकते हैं with the knowledge of entrepreneurship. और जो मुझे जो theme समझ आए from this discussion largely were technology को समझें, networks को use करें और अपना enthusiasm high रखें कि this is a very great tool to help you surmount these challenges. So Raghav, big thank you to you. And जो लोग हमारे साथ जुड़ रहे हैं, heygo.com को जरूर चेकआउट करिएगा. जैसा कि हमने थोड़ा सा स्निपेट दिखाया था आपको, you can literally take walking tours through the comfort of your living room. जो भी कहीं पे भी किसी भी कंट्री में आप जाना चाहें, किसी भी शहर को देखना चाहें, जो साइन अप फॉर अ टूर और आप वहाँ पे लाइव उस टूर को एक्सप्लोर कर सकते हैं. और वहाँ चैट भी होती है, बहुत एंगेजिंग कम्युनिटी है. आई हैव बीन अ पार्ट ऑफ दिस माई सेल्फ एंड आई कैन हाईली रिकमेंड इट एज वेल. सो डू चेक इट आउट. राघव, फील फ्री टू शेयर हेगो का लिंक एज वेल. और आजकल लॉकडाउन के सिरे में न्यूज वगैरह से देखने से बेटर अगर हम कोई दूसरी जगह का शहर या कुछ देखें, तो आई थिंक हमने 1-2 साल से कई लोगों ने ट्रैवलिंग नहीं करी है, तो इट विल बी अ वेरी गुड स्ट्रेस बस्टर फॉर एवरीवन. So thank you so much, Raghav, for joining. And
thank you so much for having me.
Yeah, have a good night.
Awesome.
All
Thank
right.
you so much. Bye.
Bye. Friends, now I have a special announcement for you. जैसे कि कल क्या हुआ था कि हमारे पास थोड़ा there was a paucity of time and there was a lot of barrage of requests we got कि PMAG का performance जरूर कराइए. So PMAG has we have roped him in for a performance for 10 minutes. And I just want to say quickly, this is also a teaser for what we have in store for you this evening. आज शाम 5 बजे we have an entertainment evening. उसमें आप जरूर आइएगा. It is the finale of Avalamb this week. So do join us. And Pranav, the floor is all yours.
Hello. First of all, amazing webinar by Raghav, and thank you, Tanya, for having me. So, hi everybody. I'm PMAG, and I'm here to release some stress in the air that has been created with the situation going on. First of all, me being an entrepreneur and me being someone who started his own business of music during lockdown, I totally understand where everybody comes from. And being too philosophical, but not that much, I can only say that us being human beings, all we can do is when times get harder, we can try even harder. So yeah. This is the first track that I have for you guys. And I made this during lockdown. इसका नाम है Why Do I Feel Like? So I made this track with my younger sister. And a whole story in short. Abhi lockdown ke andar, lockdown started as something that was meant to help us, you know, by being in that antisocial state, but slowly that being in that antisocial state became its own virus for us. You know what I'm saying? It's like हम लोग सबसे दूर तो थे, but उतना दूरी हम लोगों को इतना ज्यादा दूर ले गई कि हम लोग एक्चुअली सबसे दूर हो गए. और इसका एक एग्जांपल मैं दे सकता हूँ कि मैं अपने घर पे, मेरे घर, आई लिव इन अ जॉइंट फैमिली, मेरे घर पे 7, हम we're 7 people टुगेदर, और मैं और मेरी सिस्टर हम लोग साथ में बैठे थे. और लॉकडाउन की हमें इतनी आदत बन चुकी थी कि हम लोग साथ में बैठ करके भी अपने फोन्स पे लगे हुए थे और हमने कितने दिनों से एक दूसरे से बात भी नहीं करी थी. सो that's what I meant by lockdown being its own anti-socializing being its own virus during the lockdown. And me being a musician, मेरे पास सबसे पहला एक thought आया कि this anti-socialness को break करने के लिए सबसे अच्छा way होगा by creating music together. And that is a true fact. This is also from music therapy. Making music together and or singing music or performing music together actually helps you socialize. So we made this song together. I made this track with my younger sister. She's the one who's singing over this track. This track is called Why Do I Feel Like? I'll just play it for you. She made the video for it too, and I hope you guys like it.
Why do I feel like I could lose you? Why do I feel like
Wow, that was really amazing. We're
Thank
getting a lot
you.
of comments as well. Shruti says great. Chika says I'm amazed with the composition. It's really
Thank you.
good. So amazing job, PMAG. We have time for one more performance.
Okay.
So you can feel free to choose whichever one you think will be.
All right.
Yeah.
So I actually made this track for, wait, I'll just put it on. No. So I created this track during the lockdown. I come from an Arya Samaj family. So I've grown up singing a lot of religious chants, and Om Namah Shivaya being my favorite one. And that too because Pranav actually means Om when you define that. So my name is Pranav and that means Om. So I used just the chant Om Namah Shivaya and created that into a track, a dance track, but it has its own power to it when it goes into a dance track. And I'll just play it for you, and I hope you guys like it, everyone.
Thank you so much, Pranav, for that
Thank you.
amazing. मैंने कभी नहीं सोचा था मैं ओम नमः शिवाय जो words हैं उनको ऐसे सुनूंगी. So thank you so much for that. And we will move on to our next session now. Thank you so much for joining, everyone.
Hello, good afternoon, everyone. So, just a little break. Till then, Dr. Chandrakanta, can we have mic test also? Audio test? Hello, Dr. Chandrakanta, can you hear me?
Yeah, I can hear you. Thank you.
Okay.
Good afternoon.
Okay. We are going to start within a minute, just a small break. And Urvashi ma'am,
Sure.
can we have an audio test with you as well?
Yeah. Hi.
Hello, ma'am. Okay. Good afternoon, everyone. A warm and a humble welcome to our marathon of webinar, Avalamb. My name is Shivani Bhatia.
And I am Mahima, and both of us will be your moderators for the day.
A brief introduction about SHARP NGO. SHARP stands for School Health Annual Report Program. It's a pan-India non-governmental health organization which is working from over 22 years in the field of holistic development and healthcare of students and community.
So last year, I was working with this professor from a university in Bangalore, and we started researching about public health laws. When the COVID-19 pandemic was imposed, what kind of laws did the government turn to? What legislations were in place? And I came to know this one thing. As far as public health laws go, the Epidemic Act of 1857 was imposed to control the epidemic. But we did not have a public health legislation in place back then. Now that we're talking about the post-COVID world and there's all this talk about what happens after, we've invited some people from the policy space and the public health space to talk about what happens in this public health world. Are we looking at policy changes? What are we looking at in the education sector? What is happening in the world out there? How can we visualize the post-COVID world? Let's answer some of these questions today.
And for the same objective of discussion, we have with us Ms. Urvashi Prasad and Dr. Chandrakant Laharia. A few instructions before we start the webinar. We will let each panelist speak first, and then we will have the Q&A round. I request all the panelists to drop in their question in the Q&A box. As you know, we give a sharpest question of the day, and you get a chance to win a gift voucher worth ₹500. Mahima, can we introduce our first panelist, Ms. Urvashi Prasad?
Absolutely. Urvashi ma'am is a public health specialist working with the Niti Aayog with several development sectors to his name. Ma'am has been in the policy space for more than a decade and has several laurels to her name. She's also been a part of these webinars quite often, and it's always a delight to listen to her. It's truly an honor, ma'am. Over to you.
Thank you. Can you hear me?
Yes, ma'am.
Yes, ma'am.
Yeah. Okay. Yeah. Thank you for having me here again. It's always a pleasure to be here. And this is a very important topic that you have chosen, the post COVID world. And I certainly have very strong views on this whole issue of public health and how we approach the health system in India. And I think, I'll make a few quick broad points in that, and then of course, we have the other panelist also, and then of course there'll be questions. So I think we can go deeper into it. But just broadly speaking, I think one very important issue that we have had historically is that we've always seen health as a social sector. And I think that positioning of health really needs to change, because health now, unfortunately, it's taken a pandemic for many people to realize that health is not just a social sector. It's as critical for your economy, as critical for education, for livelihoods. So it's as much of a sector which should be focused on from an economic point of view, as we do from a social point of view. So I think that first, just how we position, the health sector needs to be looked at very carefully. And hopefully in the post-COVID world, now that we've had this pandemic, there will be a greater appreciation that, we cannot just bucket health into a social sector category. The other is that the way our health system and our approach to healthcare has been over the years has been disproportionately focused towards curative care. So when we think of health systems, we think of hospitals, we think of health centers, we think of doctors, nurses, specialists, and of course you need all of that. I don't think anybody can argue that you don't need that. But what you also need is a very strong public health component. And when we talk of public health, it goes beyond the health sector. Public health also involves social scientists, it involves behavioral experts, it involves economists, it involves epidemiologists. So these are not doctors, these are not nurses, but these are people who can actually give you the insights that you need for changing people's behavior, for creating awareness about health, and for implementing preventive interventions at scale. I think the most important thing that we need to do, and I think we needed to do it much before the pandemic as well, but hopefully the pandemic will serve as a catalyst for us to make this change now, that we have to reorient the health system much more towards public health, preventive care, wellness, and of course, primary health care. Because primary healthcare also has a big component of early detection. And we know that a lot of diseases, the earlier you detect them, it's the same for COVID, it's the same for non-communicable diseases, be it like cancer or heart diseases or diabetes. The earlier you detect someone, the better chance you have of treating them more quickly, more efficiently, more cost effectively. And the lesser of a burden it becomes on the health system, because if I have to treat someone in an early stage, it's much easier for me as a doctor, as a medical professional. But if somebody comes to me at a very advanced stage, it becomes very difficult. So this reorientation towards prevention, health promotion, wellness, and primary healthcare requires us to think of the health system very differently, to think of it beyond curative healthcare, to think of it beyond hospitals and doctors and specialists, but also look at other cadres of health professionals, be it nurses, nurse practitioners, allied health professionals. So we need to think of it in a much broader sense, and we need to reorient it. Now, the challenge with the reorientation, and I'll say this as someone working in public health for many years, if your public health system is successful, you actually have nothing tangible to show. And that is the beauty of public health. The absence of disease means you have succeeded. But that also makes it very difficult to tangibly show and prove, right? So if I am a politician and I'm standing in a rally, it's much easier for me to say that I constructed 10 hospitals than for me to say that, due to my public health interventions, I have saved 100,000 lives, because fewer people are likely to relate to that or to understand what I really mean. So that is a big challenge with public health and preventive health in general, is how do you communicate the huge benefits that will accrue into the future, because the benefits might not be immediate, but they will accrue into the future. And how do you make people realize that absence of disease is actually where you need to be? if more beds in your hospitals are empty, that actually means that your health system is probably doing well, if you're keeping more people healthy and out of hospitals. So I think that, as much as we know that we need to do it, it becomes a communication challenge. It becomes a challenge of making decision makers, making the public at large appreciate the benefits, the advantages of health promotion, wellness, public health. But there has been traction, and especially now with the pandemic coming in, I think many more people have started to get this appreciation, that we cannot simply keep pushing people into hospitals. How many hospitals will you keep building? How much oxygen will you keep getting? How many ventilators will you keep getting? This is not an efficient way to handle any health crisis. Of course, you will eventually have some people falling sick, no matter how good your public health interventions are. You need to be prepared for such people. You need to provide them the right medical care. But you should not have an over medicalized approach to the health system, which historically sometimes we have tended to do. We have tended to have a very medicalized approach, and we have tended to neglect the other disciplines of public health. So I think, and one last point I would make here is also to just illustrate the behavior change. Last year, many of us, driven almost by fear, started wearing masks, started, being careful about social distancing, started being careful about hand hygiene. But slowly, that behavior started to slip away. And the reason for that is because we are not habituated. We are not used to always doing it. The short term for which we were able to put on that behavior was driven largely by fear. There was a national lockdown, there was a new disease. So there was a fear amongst people. As the fear factor went down, people started to go back to their normal, ways of living. And unfortunately, our normal ways of living do not have these practices as inculcated or habituated. So that is where your behavioral sciences come in. That is where, we need to involve experts who can tell us how do we help people to change their behaviors in a sustainable manner. Because this is not about 1 month, 2 months, 3 months. Hand hygiene is important always, whether it is COVID or no COVID. You always need to follow hand hygiene. You always need to follow certain personal hygiene measures if you want to protect yourself against a whole host of diseases and infections. So I think that I just wanted to illustrate with that is not a doctor's job. That's not a specialist job. It's not a cardiologist's job or, a nephrologist's job to keep saying, okay, how do I make people change their behaviors? That is a behavioral scientist's job primarily. And so you have to invest in these other disciplines, in public health professionals, in public health cadres, so that you can reorient your health system successfully, so that you can keep a majority of people healthy, well. If they fall sick, detect them early, rather than letting them advance to a very complicated stage. That is what the focus needs to be. And I hope that COVID pandemic, it's a very unfortunate thing, obviously. But as they say, every crisis also brings with it opportunities. So I hope that we will use this as an opportunity to truly reorient our health system, to restructure it, to reprioritize what we should be doing, and to be investing in many more types of professionals and categories of professionals beyond doctors and specialists. So that's what I would say for my opening remarks, and would be happy to, obviously take any questions or any discussion on this. Thank you.
Thank you so much, ma'am, for for that wonderful insight on how we're looking at the picture of public health. Before we move on to the next panelist, I have just a small question. I mean, you've been working with NITI Aayog for quite some time, and obviously one of the major agendas is to implement the Sustainable Development Goals. So this sudden wave of COVID and the pandemic that India is moving towards, how is this impacted by what indicators the UN is laying out for us, or what we're looking at in the world perspective?
So what we've done with SDGs, of course, is that we've come up with our own indicators. So while the UN has a broad framework, we have adapted the indicators to what would work best in the Indian context, because the global indicators might not always translate exactly in the same way into every country. And of course, in India's case, into every state, because, the SDG index and the way we track different indicators actually There are a lot of differences between states as well, which we need to take into account, because India, as I say, is many countries in one country. It's not one country. So we have tried to localize it. We have tried to adapt it. And definitely the COVID situation is impacting a whole host of SDGs. It's not just in health, but education. We've seen education has been disrupted in a big way. We have seen digitization come in, which is, of course, a positive. But there is also the digital divide that we need to tackle on the other side. So that challenge has also come in now in the post-COVID era, and that actually impacts across SDGs. The gender equality SDGs have been impacted by COVID, because we've seen that women have yet again witnessed, unfortunately, a disproportionate impact on social, economic, other well-being indicators. We've seen instances of domestic violence go up. We've seen many women not get the kind of maternal health care that they should be getting, or they missed out on screenings for cervical cancer or breast cancer. So again, the impact of COVID is on those SDGs as well. So it's on all the economic, livelihood related SDGs. Again, COVID has had a big impact, because especially the poorest, the vulnerable, the migrant workers, the small businesses, they have definitely been impacted, and it would take intervention support to get them back up to where they were in the pre-COVID scenario. So I think impact has been across all SDGs. But what we have done is that we have tried to adapt all those indicators to our context, the general indicators, and now, of course, we will track them, even in this post-COVID scenario, that what is happening, where have we fallen back, where do we need extra interventions now in this post-COVID scenario.
Thank you, ma'am. Swani, your panelist.
Thank you, ma'am. Thank you, Mahima. So now I invite our next panelist, Dr. Chandrakant Laharia. He is a medical doctor and a leading epidemiologist, vaccine health policy and system expert. Sir has worked with academic institute as well as international health organization with regular publications in leading newspapers and popular magazines. Sir has spent 13 years working in the World Health Organization, where he led the immunization and health system related work. Dr. Chandrakant has worked closely with India's leading health policy makers and currently advises on India's response to COVID-19 pandemic. With several awards and recognitions, he is the lead co-author of book Till We Win, India Fight Against the COVID-19 Pandemic, published last year. So, honored to have you on floor. Over to you. Hello, sir.
It's indeed a.
I think there's some network issue. Hello, sir.
Yeah,
yes,
I
sir.
think, yeah, good afternoon, and thank you very much for this invitation. It's my pleasure to speak here. I would quickly come to the topic which has been assigned to me. We are going to talk about post-COVID world, and then I'll focus upon a bit about school health services and what impact.
So maybe you could try turning
will have.
So maybe you could try turning off your video and speaking. There's a lot of error.
Post-COVID world.
I think Mahima, he cannot hear us.
Yeah.
Yeah. Can you hear me now?
So you can switch off your video.
Yeah.
Okay.
So switch it off. That will be better.
Okay. So I'm not sure what is happening.
So it's totally fine. You can switch off your video and you can continue.
Good afternoon. So I was talking about post-COVID world. So the post-COVID world will have two different phases. One, when we are still in the pandemic period, And then another one, which when the pandemic will be over, but virus will still be around. So we have to be prepared for both the periods. Since we are seeing in India that second wave of COVID-19 pandemic is really severe, which has really dashed some of the hopes that by end of this year or early next year, the world would be out of pandemic. So we should be prepared for some more time, a little longer period to live in the COVID-19 pandemic period. So in this period, and then there would be one longer period when while pandemic would be declared as over, but the virus will still be around. In both the periods, we have to follow a slightly different approaches. But one of the common approach in this period would be, which I would call reject, revive, and innovate. What this pandemic has taught us that there are a few things which we were doing as a society and as an individual wrong, which need to be rejected. For example, we need to be more careful about protecting our environment and climate. And if somebody asks me, what is the linkage with environment and climate to the pandemic? There is a strong linkage. It is the deforestation which resulted that human and wild interface, and this resulted in the virus age and pathogens which were till now were living only in the wild are now started affecting human beings. So deforestation in a way results in entry of the pathogens in human society and results in pandemic. Similarly, the climate change, the change in the temperature can make newer pathogen to survive for longer. And that's why we are more prone to epidemics, outbreaks, and pandemics. So if we want to keep our society healthy and protect, then we have to reject some of the harmful practices of damaging environment, doing anything which changing the climate, etc. We also need to reject unhealthy lifestyles. We also need to reject the unplanned urbanization and need to be focused more on a healthier and better organized urban system. So one approach which entire society need to follow is a reject. The pandemic has also affected each one of us. And some of the activities have been affected. So what we need to do is revive everything which we were doing right and we were doing good. As an example, we need to revive our healthier lifestyle, but we also need to revive need for stronger mental health care services, which will be needed far more than the previous pre-pandemic period. And third effort which we need to do is innovate. In the pandemic period, we have learned that how with limited resources, we can achieve some of the common outcomes. And one of the innovative approaches that using mobile and appropriate technologies for improved day-to-day life and the health services. So that's how pandemic is going to be in and post-pandemic period also. How this post-pandemic period will affect us at the school levels or other facility level? The answer is, let's take example of 3 or 4 things which we have learned extensively in this pandemic period. And one of those is hand hygiene. We have learned to stay safe and healthy. We need to keep sanitizing or washing our hand. So one is hand hygiene. Second is a respiratory hygiene. We need to wear face mask. But we know that while we were wearing face masks to protect ourselves from the COVID-19 disease, but there are evidence which have emerged that use of face mask has on improved respiratory hygiene has also reduced other respiratory diseases. So we need to keep following or adopting those respiratory hygiene practices. Third thing which pandemic has taught us, that there was never a better incentive than now to stay fit. So we need to adopt a healthier lifestyle in a period ahead. And of course, all of these we followed, which means a human behavior is amenable to external environment changes. We could protect ourselves by adopting a few healthier lifestyle of hand hygiene, respiratory hygiene, and also, so all of these behavior can, if we continue in the future, there are non-communicable diseases, obesity and diabetes, hypertension, which are essentially caused by preventable factors, a large proportion of them. Healthier diets, regular physical activity, no smoking, these are some of the preventable behavior. If we follow, we can avoid the non-communicable disease. So if we can adopt one particular type of healthy behavior for COVID-19, we should continue those additional healthy behavior to prevent future and burden of non-communicable disease. So in school health services, as schools will be open as and when, and for children, teachers, and their family members, I think it will be a good opportunity to highlight and sustain the practice of hand hygiene, improved respiratory hygiene, the behavior to stay fit. All these should be inculcated and given further emphasis. What additional impact of this COVID-19 pandemic will have in school health services and should be utilized? I believe that the importance of health services or school health services is really very high. Unfortunately, in India, the school health services, both in public sector and private sectors, are not fully implemented. Though there are provisions of 6 monthly or annual checkups, but those are not done that frequently. And that's true for both public sector and private sector. I would argue that this is the time where children are not only the messenger to the family to convey healthy practices, but we need to take care of health of the children themselves. So school health services in next school session or coming periods need to be strengthened and proactively strengthened by the policymakers, but school principals and headmasters, headmistress need to take care of this thing. So more proactive attention would be required on school health services, where the regular checkups, regular preventive or promotive education to the children is part of the curriculum. These are some of the weak areas which need to be given regular attention. I also want to argue that in the period ahead, both in the schools and probably in the colleges also, there would be need for higher attention on teaching on health, various aspects of health, which could be health hygiene, but also some of the broader policy principles of what is public health, what is medical care, when do one need one particular type of health services, and a healthier lifestyle, which should be inculcated or given to the children. Here, one of the government initiative, which had been started 3 years ago, Ayushman Bharat program. As part of that one initiative, there is something called Ayushman ambassadors, where school teachers are trained to give us some basic education to school children, and Ayushman messengers, who are the school children who will take us some of the healthy lifestyle message to their family members. So there are some of the initiatives which we need to harmonize or optimize in the period ahead to stay healthy. Finally, one of the key points which is relevant to the schools says that, of course, schools will be opened at a particular point of time, and right now is not the time. But there is a wider discussion going on about the vaccines, which have now become available and open for all adults 18 years plus. But for less than 18 years, so the vaccines are not available. So people are asking when the children will get vaccines. One of the key things is that children are not, they use frequently this word little adult, which means they are not the same as like one adult you give a vaccine, and the similar vaccine or same quantity of vaccine can be given to children. Children react very differently to vaccines. Their immune system is very different. So currently licensed vaccines, both in India and abroad, have not been tested, or the clinical trials were not conducted in children. They were conducted in mostly 18 years plus, in one particular setup for 16 years plus. So something which has not been tested on a particular age group is not recommended. So currently available COVID-19 vaccines, except one, which I'll talk later, currently available COVID-19 vaccines, and none from India, have been approved for use in the children. But the clinical trials are going on in India on both the vaccine for 6 to 17 years of age. And once those trials are over, based upon the findings of those trials, so vaccination for children will be open. We also know that yesterday only in Canada, one of the vaccines, Moderna vaccine for COVID-19, has been approved for 12 to 16 or 17 years of age, but in India, it has not been approved. And finally, before I close my this brief intervention, one of the discussion which is coming and which many of you would have heard, that India is in the second wave of COVID-19 pandemic. And there are various discussions going on which say that the third wave, which is likely, which is expected, we can avoid partly, but which cannot be completely avoidable. So there are a lot of discussions going on that third wave could be a little riskier for children. The reason is that the adult age group, which is already being affected, so the adult age group will develop immunity and the risk of transmission will be reduced, but children would continue to remain susceptible. And when the new wave or third wave appears, that time it is likely a risk that children could develop the disease, because virus will not find much of the scope in the people who are already vaccinated and exposed, but children are neither getting vaccine nor they are that much exposed. So there is a risk of higher risk there could be theoretically a higher risk of disease in the third wave. And that is exactly the point all of us as an individual, as a family, as society, and of course we are talking in context of schools, need to pay attention that the protective behavior or COVID appropriate behavior in children is sustained in the longer period. As and when there is attention on this opening of the schools, those behaviors are strictly adhered to and followed. Of course, we can hope that the vaccine will be licensed for this appropriate behavior. And we really don't know that whether how new strains will behave and how long the immunity after previous infection lasts. So our responsibility becomes even higher for the children. And what we learn from this, once the pandemic is over, we will still have virus around, and in that period we will utilize to reject, revive, and innovate. I stop here.
Thank you so much, sir. I think though we lost you a little in the end, some very important points have been discussed, like reject, revive, and how we think about COVID, what investments in school health are being made, and why is it going to be such a pioneer for the cause of COVID-19 and the post-COVID world that we're looking at. We have a question from Miriam. Mariam, you can just unmute yourself.
Yeah, ma'am.
Hi, Mariam.
Hello, ma'am.
Hi, you can just ask your question.
Yeah, actually, my question is that nowadays, as you know, due to pandemic, the women are at home and they are overburdened with the works because they have to look after their kids, their family, and moreover they are at work at home, so they have to concentrate on their work also. So doing all these things, their health issues are remain unattended because they don't have time to look after their body, the health issue. So basically women have lot of menstrual problems, having a pregnancy problem. So internal, so many changes are going on, and there is no, because of pandemic, they cannot go to doctor and see the things, because we have to do ultrasound, we have to do the various tests, if mammogrammy, if any breast cancer is there or not, in uterus it is there. So all need some test and all, and because of this pandemic, it is not happening. So once post pandemic, after this pandemic is once over, when they go to the hospital, I am having the doubt whether that time, if this disease become later on stage, if they detect, then it will be diagnosed, then it will be very difficult for them to recover and to rejuvenate from it. So how we can help them out?
Right, that's a very
thanks.
relevant question. So you wanted to answer it?
Yeah, thanks. I had missed the middle part of the question, but I got a broader gist that the women are stuck at the home and then health services are not available, and which is likely to affect the health outcomes of women. Yes, I completely agree with you. The challenge which has been here. Fortunately, in the first wave of the pandemic, there was scope that essential health services, non-COVID-19 health services, but still non-COVID-19 health services were still continuing. But as we are in the second wave of, hello, can you hear me? Hello?
Yeah, sir, we can hear you.
Yeah, as we are in the second wave of COVID-19 pandemic, and we know the health services are really overwhelmed. So there is a real risk of some of the routine conditions which are essential not being able to. Actually, there is no real answer to this thing, and that what brings attention on that an individual need to take best care of himself and herself in this period. And as once the second wave is over, health services are relatively available. The earliest they should utilize these the opportunity to get health services, which which would be due for some time. Having said that, I would also say that one of the thing with development in the COVID-19 pandemic period has been to consult over the phone. So it will be worthwhile that if any individual, women, children, or anybody who has health need, which at least can be consulted telephonically, and thereafter a decision can be taken.
So we losing you network-wise.
Healthy. And if need be, do a teleconsultation. Hello.
So we're losing you network-wise. We can't hear you, sir.
Yeah, I know there is. I don't know what issue is, but anyway, I'm not sure where I was. But let me summarize this part. That one, in even this COVID-19 pandemic period, everybody should be aware about their health needs. Second part is that they should do whatever in their personal capacity to stay healthy. Third, if they feel the need, please use the teleconsultation services to talk to a healthcare provider. And fourth, based upon that assessment, there are still some facilities which are providing non-COVID essential health services, but there is a risk involved in attending healthcare services. So balancing the risk and benefit, they can visit this thing. But we can hope that in 6 weeks from now, hopefully we will be in better condition. And if there is a health need which can wait for that much, soon after that individual should go for that kind of health need.
Thank you, sir. That's beautifully summarized about the kind of findings we're looking at. We have a question from Shikha. Shikha, hi, can you hear us? Hi, Shikha. Okay, I think there's a lot of issue today. So Shikha's question was that India being the second most populated nation in the world, leading to deforestation, and there are some reports that say that viruses like corona increase during wildfire destruction. And the panelists have also highlighted the deforestation point. Is there any scientific basis to this? Urvashi ma'am, would you like to take it up?
Yeah, sure. So I think it's not just deforestation, but a broader point of living in balance and harmony with the environment. And I think that is the bigger issue here, because whether it is forestation or deforestation, whether it is utilization of water resources, whether it is our agricultural practices, whether it is, our emissions, our factories, our construction work that we are doing, our transport systems in cities. Now we have in many big cities, we have every household sometimes, or many households, where there are multiple cars. One household has multiple cars. Now, all of that has environmental consequences. So we need to think, of course, forestation is a big part of it, but in general and much more broadly, we need to think about how do we live in greater harmony and balance with the environment. Yes, we need to progress economically. Yes, we need to obviously, we have our urbanization, we have industry, industrialization, we have all of that. But how do we balance those goals? And of course, in India, we have taken it up at the highest levels as well with respect to climate change, carbon emissions, and there are many such goals that we are committed to reducing, our carbon footprint, increasing our use of renewable energy sources, reducing our use of non-renewable energy sources, etc., etc. So I think it's a much broader point here, because the more you disrupt the balance with the environment, it's not just COVID, but it's so many other problems that you can potentially create. Agriculture, for instance, if you don't use, environmentally friendly agricultural practices, then it can eventually impact the kind of, crops that you are producing, the kind of nutrition that is going into people. So I think we need to look at the whole environmental angle, and that's why I said we need to look at public health much more holistically, because there are many other angles to this, and environment is definitely one of those. So I think that is what we need to do, and that's what we are at least trying to do through our SDG efforts as well. That how do we make the linkages between these different SDGs? As I said, health is not just one SDG, but it's also related to environment, to gender, to education, to all of these, and so we need to see it in that composite way. But I think one more point quickly I will make here is that in addition to what governments do, individuals have a very big role to play as well when it comes to the environment. Because as I said, our own practices also make a big difference. If you can take public transport, if you can reduce the load on the environment, you don't have to take out your car every time, that itself can make a difference. If you can use water judiciously in your household, if you can use electricity judiciously in your household, we leave a lot of lights or fans on in the house, or sometimes we leave the tap running. I mean, these might seem like very small, insignificant things, but they all add up, and they eventually make a big difference. So of course, governments have to take this up, private sector has to take it up, businesses have to be responsible, but I think citizens also have a very big role to play in making sure that we are living in balance with our environment.
Right, ma'am.
Absolutely. Yeah.
Thank you. Thank you so much, ma'am, for explaining so well. I think she got her answer. So now our next question is from Kiran. So can we have Kiran? Hello. Hi, Kiran. Please unmute yourself.
Hello.
Hello. Hi, Kiran.
Hello.
Hello.
Hi, ma'am. Hello. Good afternoon, everyone.
Hello. Good afternoon.
I'm Kiran Timothy from Chandrapur, Maharashtra. So my question is, there are many after effects of COVID. Even after recovery, what precaution we need to take at home after recovery? And nowadays, people are not getting medication. Thank you, ma'am.
Sir, would you like to take up this question?
Yeah, sure. So thanks. This is a really important question, especially when many people are coming home, recovering from the disease, which is good. So one of the key things is that anybody who recovers from COVID-19 need to follow the same COVID appropriate behavior in the subsequent period also. So hand washing, face mask, and physical distancing is equally important. Second part is that after recovering from COVID, taking good care of your health is more important than the earlier, because we know that COVID has some of the effects which are long lasting or which is called long COVID. It may not affect everyone, or it may not have that kind of visible effect on everyone, but we know that people feel tired, people have some breathlessness and some of the common symptoms even after the recovery. So in that setting, it is important that person take sufficient rest, do some breathing exercise, but also have a healthier diet. So following all those things which are good for health, you need to keep doing. Third part is that if anybody have any of the symptoms or any feel that there is some difficulty in breathing or any other physical disability, it will be important to keep following with your physicians or healthcare provider. It could be the same facility where you were treated, but you can go to any other facility. It's not necessary that you go to the same facility. Fourth is that people who have recovered from COVID in the recent period or even in the past, now vaccines are available. Often they ask whether they should take vaccine or not. The answer is that though an individual who developed COVID, which is a natural infection, gets some antibody which may last up to 6 to 8 months. But current recommendation, Government of India say that a person need to wait for 4 to 8 weeks. I'm saying 4 to 8 weeks after the recovery from COVID-19 to get vaccine. But WHO says that the person can wait for up to 6 months after recovery from the disease to get COVID-19 vaccine. Short point is that even if you recover from the disease, you need to take your vaccine, but a gap of 4 to 8 weeks minimum or longer will be required. Final point is that I would say that taking good care of your health is as important as earlier, or probably more than earlier.
Thank you so much, ma'am. I think sorry, I'm so sorry. Thank you so much, sir. Kiran, I think you got your answer summed up in so many points. So thank you so much.
Yes, thank you, sir. Thank you so much, sir.
You're welcome.
Sir, ma'am, last question that I have in mind, that we spoke about public health, we spoke about preventive care and for women health and hand hygiene and everything. So can we talk about what will be the issues or the opportunities for rural healthcare? I mean, post-COVID. Urvashi, ma'am?
Yeah, so I think, rural, one of course big factor, and that's true for urban as well, but equally so in rural areas, is the whole behavioral patterns, the awareness, because a lot of times in urban centers you might still have a little bit higher awareness of certain issues. Sometimes in rural areas that can be lacking, especially in the very remote rural areas or tribal areas, for instance. So we need to make sure that the awareness is actually reaching in every part of the country. The social stigma related issues need to be addressed, because we spoke of women's health, spoke of screening, for instance, for cancer. Now there's often it's not just an issue of availability of the services. Of course, that is also often a big issue in rural areas, that the services itself might not be as available, or they might not be as accessible, or the quality might not be as good because there's a shortage of health personnel in rural areas. We know that it's often very difficult to get adequate quality and quantity of health personnel in the rural and remote areas. So that is of course an issue, but sometimes the awareness also and the social stigma can also be very high, or there can be various cultural factors that come in as to why women might not come forward to get screened. And it's not just women, it applies to all sorts of health services, but I'm just giving an example here because we spoke of women's health and we spoke of screening, etc. So I think awareness, persistent behavior change, sustainable behavior change, not just a one-off campaign, but sustained behavior change through local channels, communication, which works effectively at the community level. Then I think involving the community, groups that we have, and a lot of these are very strong in rural areas. So your self-help groups, your various other types of community structures are often actually stronger in rural areas, because that sort of bonding is much more. In urban areas, sometimes because people come from different parts of the country, that inherent bonding between people is sometimes not as much. So in rural, that is an advantage which we can use. We can use those community groups, those community networks, to consistently put out these messages about health and nutrition and well-being. So I think that is something we need to do on the demand side. On the supply side, as I said, we do need to increase our availability of health professionals in particular, in addition to, of course, the infrastructure itself. And we need to focus a bit more on the non-communicable disease side now, because, historically we focused a lot on maternal child healthcare, communicable diseases, and that agenda is not over. We still have to do a lot of work on that. But the non-communicable diseases are now also coming up in a big way. And we need to make sure that we have the infrastructure, we have the services in the rural areas as well to deal with it on the supply side too. So I think that is how we need to look at it, both in terms of the demand as well as the supply side.
Right, ma'am. Very well explained. Thank you so much. So we have one last question from our audience, and for that I would like to call Neva. So can we have Neva? Neva, please unmute yourself. Hello. Hello, Neva.
Hello.
Hello.
Hello. Yeah, I was not able to unmute. Hello.
Hello. Yes,
Hello?
we can hear you. We can hear you.
Yeah. So my question is that it is being said that the third COVID wave is going to affect the children. So are we anticipating any type of lethal mutation, and we just underestimated the UK variant, and the second wave created such an havoc and affected all of us? So my question is this: why are we expecting that the third wave, if there is any, it's going to affect the children?
So would you like to take up this question?
Sure. So I think I tried to explain, but network was poor at that time. So key thing is that when we try to understand diseases, or which means outbreaks, epidemics, or pandemic also, they are always outcome of interaction between agent or disease causing agent, in this case virus, host, the person who are affected, their factors, and external factors such as environment. Now, what we have seen till now, that before this second wave came to India, there were around 22% of the population which was found seropositive, estimated 22% through the national survey, which means around 80% or 78% of population were susceptible before the second wave. That was after zero survey, you might have read in the newspaper. Now, this pandemic, this particular wave, second wave, ongoing second wave, a large proportion of population is getting infected, which means all of those who are getting infected, or whether asymptomatic or symptomatic disease, will have some form of protection or antibody. Since once this wave will be over, there will be a XYZ number, or a particular number of people who will be either through natural infection or through vaccination, because we are conducting adult vaccination also, will develop antibody and protect it. Now, if third wave come, the population which is likely to be most susceptible means they would not have received vaccine by then, because we are not doing vaccination for children. And the proportion of population which would have developed natural infection in children will also be less, which means the susceptible children, due to not receiving vaccine or neither due to natural infection, will be fairly high, while adult population would have already been vaccinated or developed infection. So it is being assumed, it's not necessary, but it is expected that if virus is still around and circulating around for the third wave, if cases spike, children are likely to be more susceptible. So of the total cases which might come up during that period, more might come from children. And that's the epidemiological explanation for this thing, that virus is still circulating, and then it will affect the susceptible population, which is likely to be children. But this is based upon some of the assumptions, because adult population will be vaccinated or natural infection antibody, but we really don't know. However, these are the public health advices based upon some principle. it is always beneficial that we follow those advisory or public health advices, so we are better prepared. We protect our children in a different way and sustain the COVID appropriate behavior more rigorously than earlier.
Yes, thank you so much, sir. So thank you so much to our panelists, Ms. Urvashi and Dr. Chandrakant, for such an effective discussion we had about the public health interventions, post-COVID world, about the third wave, third wave. So thank you so much once again. So Mahima, would you like to add something?
Just that, I mean, a lot of my own questions were answered, which I have also always wondered about what happens now, what are we looking at from the policy space. As I said, we had in vogue like an 1857 Act. So are we looking at some changes from the policy perspective? I think it was a very interesting discussion. Thank you to everybody who asked their questions. We'll be announcing the winners at 6 o'clock today. So stay tuned. Anything from the panelists side, just on a closing note? Urvashi ma'am, sir, if you're there.
I think one of the key things is that the world is in the pandemic, and we are all of us have some uncertainty. But one good thing and one hopeful thing is about pandemic is that world has always won, and we have vaccines so soon. One thing is sure, that we will win against this pandemic. This victory will be possible through public health interventions, which government need to take. But as an individual and citizen, it is our responsibility, and if the participation of citizens which will make those interventions successful. So health experts, government can only guide, but victory against this pandemic will be citizen adopting that behavior. So keep following those COVID behavior and encourage others to follow those behaviors, and do double masking if you are going in the public, because we know that now the virus is spread through, in addition to droplets, the aerosol also. So please wear double mask, and appropriate double mask approach is that you wear a surgical mask and then a cloth mask on top of it, which should cover your nose and mouth.
Right. Thank you so much. That was all for this particular panel discussion. I can see that Ramakrishnan sir has already joined. So Shaheen will be moderating this session. So over to you, Shaheen. It's your panelist.
Thank you so much. Thank you, Shivani. Ritik, can we have a mic test? Yes. Hi, sir. Sir, can you hear me? Yeah. Sir, can we have a quick mic test as well? I can see you very well, of course.
Sure. Is this working?
Yes, it's fine, sir. Great.
Okay, great.
So we'll just start in about 30 more seconds, maybe.
Sure.
All right, sir. All right, so I guess we are good to go. Can we go, sir? Yeah. So once again, a warm and a very humble welcome to all of you to our very special initiative, Avalamb. And here we come to its last day today. So I would like to introduce myself first. My name is Shaheen Rahman, and I will be your moderator for this session. So we all have been seeing and personally experiencing this unfortunate time when our entire nation is facing a devastating second wave of the COVID-19 pandemic. So to find a way of hope and to support each other at this difficult phase, SHARP NGO has taken this initiative to bring a change in each one of us' mind and lives. But before moving ahead, let me introduce you to SHARP. SHARP stands for School Health Annual Report Program. It is a non-governmental pan-India health organization, and we have recently completed 21 years in this field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, educationists, counselors, and people like you and I who have the vision to promote healthcare. Now, speaking about our initiative, Avalamb. Avalamb is a national level campaign by SHARP NGO to raise hopes of people during the times of pandemic. It spreads over 6 days to support and to keep everyone together as we sail through the second wave of the pandemic. We have a series of interesting and involving webinars listed all for you to attend, and our next event, which will be the last event of our series, starts right after this session ends. So coming back to our communicative talk, today we will talk and discuss about a very familiar yet often ignored community, the LGBTQ community, and the pandemic as a challenge for the inclusivity. So today, before having the talk, we will. I'll just tell you brief about how it goes. The first 25 to 15 minutes will be a light conversation with Dr. Ramakrishnan regarding his job, his life, and his experiences over this course of time. Also, we will start taking questions in the next 15 minutes. Soon after, we have a discussion with Sir. And also the surface question of the segment wins a Amazon gift voucher of ₹500. So all of you better be ready with your sharpest question, and we will take it as soon as we have the discussion. So without making any delay, now I would like to introduce you all to Dr. L. Ramakrishnan. Dr. L. Ramakrishnan, better known as Ramki, is a public health professional and a vice president of a non-governmental organization, Saathi, based in Chennai. He earned his doctorate from the University of Texas at Austin, USA, and has worked in health and human rights non-profit settings in USA and India. He is one of our windows to the LGBTQ community in India and is an advocate for LGBTQ community and equality and gender justice. For the past 2 decades, Sir has been leading programs, research, and advocacy that promotes access to health, legal, and social services for population marginalized on account of HIV, gender, and sexuality in various states of India. Sir, indeed, it is a very great honor to have you with us today. Welcome to you, sir.
Thank you very much, Shaheen. It's a pleasure to be here. Looking forward to the session.
Yes, sir. So, sir, getting back to the communicative talk, my first question to you is: we have had talks and discussions on the impact of COVID on women and children and other population in general. But what I feel we have been lagging or missing till date is particularly talking about the LGBTQ community. So now that we have the right person, of course, to talk about it, would you like to talk or rather educate us regarding the impact on the LGBTQ community in regard to the pandemic?
Sure, yes. And again, thanks for the opportunity. So I think a lot of people must be aware of what LGBTQ is, but just for a very quick recap, we are talking about a diverse population that is almost 8% of India's total population, which according to the Supreme Court in a landmark verdict in 2018, is about 10.9 crores of India's population belongs to the LGBTI community. And there are many letters, so lesbian, gay, bisexual, transgender, intersex, queer, etc. So this is quite an ever-evolving and complex alphabet soup. But there are 3 broad categories of people who are within the LGBTIQ umbrella. The first is people who are different from the mainstream based on their sexual orientation. So the mainstream sexual orientation is heterosexuality, where people are attracted to the opposite, if you will, gender. And people who are not heterosexual may be attracted to the same gender, that's homosexual, or to multiple genders, which is bisexual and pansexual, or to nobody, which is asexual. So all of these people are subsets of the LGBTIQ community based on sexual orientation. The other subset of the community, which is probably a lot more visible in India, are the transgender community, for whom the issue is not one of sexual orientation different from the mainstream, but their own sense of gender. Because over 20, 30 years of research in biology and psychology have showed that gender, a person's inner sense of whether they are male or female, is actually not necessarily the same as the biological sex. So an individual may be born with male body parts and may be assigned male at birth, but the individual may grow up to not identify as a boy. The child may grow up to identify as a girl or as third gender, etc., etc. So anybody whose gender identities, that is self-perception of gender, is different from the gender that is determined by biological sex would be transgender. And within the transgender, the community that's most visible are the Hijra community, which is a traditional community in India of people who are typically assigned male at birth, but who identify themselves either as third gender or as women. Yeah, there are a few other people, communities within the transgender umbrella, including people who are assigned female at birth and who identify as men. And this is called the trans masculine or trans men community. And while there are many terms like Hijra, Koti, Tirunangai in Tamil Nadu, Nupi Manbi in Manipuri, etc. For trans men, there are relatively fewer terms. So there's a term called Tirunambi in Tamil. There's Nupa Manba in Manipuri, Babu Bhai in Gujarati. So these are the common terms that we've heard. But in general, because the trans men community is much less visible than the trans women community, we don't hear a lot of terminology also. And so first I talked about people who are of a minority sexual orientation, which is the gay, lesbian, bisexual, and asexual. Then I talked about the transgender community, which are trans women and trans men. Within the transgender umbrella are also people who are non-binary, who do not identify their gender as either male or female. But there's a third segment apart from sexual orientation and transgender, which is sex characteristics. And this refers to people whose bodies, whether it is in terms of external morphology or internal anatomy, is different from the male-female binary. So you may have individuals who are born with a phenotype which is female, but who actually have an XY genotype and a particular condition called androgen insensitivity, where the body does not respond to androgens or the male hormones. And the individuals grow up with an external female body type, but may not menstruate or develop breasts during adolescence. So these are what are called intersex individuals. And very often there is a confusion in the minds of the public between what is intersex and what is transgender. Transgender are not necessarily people who are born with ambiguous genitalia or body parts that are different from male and female. Intersex is referring to such a community. So broadly, sexual orientation, gender identity, and sex characteristics are the three kind of domains under which the LGBTIQ community is categorized. And we've already said that there's about 8% of India's population, that's about 10.9 crore. However, the majority of this community is invisible. So if you look at the census of India 2011, this was the very first time when the census takers recorded a gender other than male and female, and about 5 lakh people identified their gender as other than male and female. So that's possibly a subset of the transgender community. There are a lot of other transgender people who may not have come by and who may not have been documented in the census. Okay, so one issue that the LGBTIQ community faces is living in a society where everybody is expected to be heterosexual. People with male body parts are expected to grow up to be boys and men, behave in a masculine manner, and adopt a lot of the stereotypes assigned to masculinity. And similarly, female-born children are assumed to embrace femininity and grow up to be women, to marry men and have children, right? So you have all these stereotypes linked with heterosexuality and patriarchy, with the inherent power differential between men and women. So individuals who fall outside of this gender binary and who fall outside of this heterosexuality are minoritized both within the families as well as in all other institutions, whether you're talking about educational institutions or workplace or healthcare. And a lot of our work as Sati, which is a national healthcare organization, is actually trying to address barriers in healthcare faced by the LGBTIQA community. But in summary, if we are bringing this to the COVID context, there were already many prejudices and stigmas facing the LGBTIQA community. Some of these have got amplified because of the COVID epidemic or COVID pandemic. To give you one specific example, a lot of the Hijra community, because of lack of other options primarily, are reduced to seeking alms, blessing at religious occasions, and sex work. So these are kind of the main traditional occupations. But because of the pandemic, many of them are not able to carry on these traditional occupations and are in extreme financial distress and also food security. The other issue is that while the Hijra community has traditionally been a home away from home, where children who were facing violence and bullying at home were able to run away and find some kind of support from the Hijra system, this option is not available to trans men, and this option is not available to lesbian, gay, and bisexual people. So many of them are actually facing violence in the homes. What we have documented over the past 12 months is that a lot of folks, because of the COVID, who were living away from their homes, lost their jobs and had no alternative but to go back to their natal homes, where the violence, the pressure to get married, and in the case of some transgender people, forcing them to dress not in their preferred clothing, but in the clothing that is considered appropriate to their birth sex. People who are on hormone therapy were made to stop hormone therapy. So a lot of things, a lot of human rights violations have been perpetrated on LGBTIQA communities from their families. For lesbian women, we have documented nearly 26 couples who have faced violence. This is just in Chennai, who have faced violence and have tried to run away from home. Some of whom are being kept under house arrest by their parents. And also they're being forced to get married by their parents. So these are some of the issues. The broader issues for people who are visibly different. So a lot of gay, lesbian, bisexual people may not visibly be different from the norm, but transgender people and other gender non-conforming people are visibly different from the norm, which contributes to a lot of stigma and discrimination from all institutions. So for example, children who are gender non-conforming or transgender face bullying in schools. They are unable to complete schooling. They are often unable to get a job, a mainstream job, etc. A lot of these problems have been compounded, and there's acute financial distress and food insecurity. And last year, a lot of civil society organizations pooled their resources and did outreach and support in terms of cash transfers, rations, etc., for the LGBTIQA, particularly the transgender communities. This year, the support has been even less because a lot of those folks who were able to contribute last year are in financial distress themselves this year. Plus, there is the prevalent fear of going out and getting infected with SARS-CoV-2. So these are kind of some of the issues facing the community. I'll be happy to answer more questions.
All right, sir. So thank you for that. I would say that those educating things that you told me, I personally even did not knew a few of the things, and thanks for that, sir.
Sure.
So my next question is, because you have been a member of the Sathi, so would you like to tell us some common healthcare concerns for the LGBTQ community, sir?
Mm-hmm. Yeah. So just like society as a whole, the field of medicine also has its biases. So for example, if a woman went to a doctor with some gynecological problem, okay, one of the first questions she'll be asked is, are you married? So the assumption is that her sexual life arises from marriage to a man. So a woman who is actually lesbian, who's not attracted to men, right at the beginning, they face a barrier in seeking care for their condition or seeking treatment because of the assumptions that the healthcare system has about her sexual orientation and her relationship status. For someone who is visibly different, like a transgender person, the stigma and discrimination is many-fold higher, right from the reception or the ward boys in a hospital to the fact that the outpatient and inpatient settings at the most will have male and female, and individuals who do not identify as either do not have an inpatient facility and may be incorrectly clubbed in with the wrong gender. to the attitudes of the healthcare physicians themselves. At Sati, we have done an analysis of about 12 medical disciplines, MBBS as well as MD textbooks, along with one of our colleagues, Dr. Samira Jahargirdar, who is a transgender woman and a critical care medicine specialist. She used to teach at Mahatma Gandhi Hospital. Now she's moved to the UK. But so we found that in many of the books, even though you're dealing with a 2017 or 2019 edition of the book, whether it's obstetrics and gynecology or pediatrics or psychiatry or surgery, etc., the information given on the LGBT community is very antiquated. For example, the World Health Organization in 1990 itself said that homosexuality is not a disorder. And in 2019, they removed a classification called gender identity disorder and replaced it with gender incongruence, with the realization that transgenderism is a lot more common and people who receive the support do not face any emotional distress, right? So even though the organizations like World Health Organization, Indian Psychiatric Society, etc., and even the Mental Health Care Act of 2017, all talk about LGBTIQ issues as not pathological. Many of these Indian medical textbooks are basically reprinted versions of textbooks that were first published in the 70s, and they have not bothered to update these sections. So you can open a textbook of forensic medicine, which every first-year MBBS student will read, and you will find statements like lesbians are either are nymphomaniacs, they are suicidal, they are homicidal. Then they use the word sodomy, which is a word for sex that does not involve a penis and a vagina, and they consider it an abnormality and an illness and also a crime. Whereas the Indian government has clearly said if it involves adults and it's consensual, then it's not a crime. So a lot of these problems in terms of medical content, even the competency-based curriculum that the Medical Council of India came up with recently after 20 years of not revising the curriculum, has many of these same problems. So as a result, doctors don't have accurate and updated information, and this compounds the biases and prejudices they already have. So inability of patients to be able to articulate their issues because of the biases already evident in healthcare, the kind of stigma and discrimination that transgender people will face even entering a healthcare setting, all of these are problems faced in healthcare. So one big issue is the wrong notion. It's wrong in terms of science and medicine. It's also wrong in terms of law and wrong in terms of ethics. Is the idea that a person who is gay or lesbian or bisexual or transgender has a disease and can therefore be cured. So there are unscrupulous psychiatrists even today who offer what is called conversion therapy, where they will load up a client with antidepressants or even worse, give electroshock therapy, telling the parents that, okay, you take this and your child, or you give this and your child will be okay. So all of these systems do not change sexual orientation or gender identity. They only cause a whole bunch of other mental health issues and physical issues. So I think this is a big problem in the healthcare system in India because conversion therapy is still being practiced. And in Kerala, a couple of months ago, we had the first case in Kerala High Court opposing conversion therapy, and we are hopeful of a positive result from the High Court. Yeah, so this in summary is some of the issues. If you go beyond this to look at specialized medical care like gender affirmative care for trans people who need hormone therapy or surgery, a lot of this is not available because the number of providers who are trained is very few, and the few institutions are mostly in the private sector, and they are also unaffordable to the majority of trans people. Imagine asking a trans person who's been kicked out of home, unable to complete school, unable to have a regular job, to fork out 2 lakhs for a surgery, right? It becomes very difficult. So we need more and more, resources available in the public sector that are free or covered by insurance. And Tamil Nadu and Chhattisgarh are among the states where actually these procedures are available for free in the government sector.
All right, sir. Yeah. So also because in our sessions, we have a large population from who have who are students or either teachers. So, sir, keeping that thing in mind, there was also another question in our last sessions, but I think this would be the right platform to address the question. The question is, how could we teach sex and gender fluidity to younger children as the curriculum does not always prescribe it?
Okay. Yeah, this is a brilliant question, and I applaud the people who've asked this question. I think in India, we are very queasy about sex. Even the word sex can raise a lot of eyebrows, and especially when you combine it with schools and children, the immediate conclusion that people will jump to is you're spoiling the minds of innocent children by talking to them about sex. But the thing is, even without talking about sex or how people have sex, right, there are ways to bring in the idea that people are different. And I think one important entry point over the globe that UNICEF and other organizations have been working with is to recognize that the main problem that people who are gender minorities or sexual minorities face is bullying. And bullying is a universally recognized problem where children who face bullying are they skip their attendance, and at the worst they may drop out of school. So bullying can happen for many reasons. Bullying can happen if the child appears to have belong to a different socioeconomic class than the rest of the children, or if they are wearing clothes that are not seen as really nice, or they could be darker skinned, or they could belong to a minority religion. Among these many factors, or they may have a disability. In addition to all these factors, if you have a child who is a male child but is acting in a way that is seen as feminine, or a child who's a female child but who's acting in a way that is not considered gender appropriate, the child is seen as boyish or tomboyish, such children also come up for bullying. So I think that the tactic would be to focus on making schools into safe environments for children of all kinds, whether or not the children identify as being different. The fact that difference is so quickly picked upon by other children and sometimes by staff and administrators also. I think we need to make people aware that there are many categories of children who are vulnerable to bullying and abuse, and we need to be cognizant of this and ensure that such children are protected, and also sensitize other children about the fact that not everyone is a clone, is cut out of the same cloth, and that children may differ from each other, and we have to respect this difference. Yeah. So right now I've been working with the NCERT, the National Council for Educational Research and Training, and we have just developed a curriculum for training of teachers, because before we get to training the students, we have to train the teachers, and teachers also have a lot of misconceptions or lack of information on gender and sexuality. So we just completed this module, which we will be piloting across the country, or piloting in a few places and then scaling up across the country. So teachers will also have the information to be able to deal with these issues sensitively. So we need to focus on students, but we also need to focus on teachers. One example before I go back to your question is that this is in terms of colleges and universities. The University Grants Commission sent out a circular in 2016, which is an appendix to the anti-ragging regulations. So in this particular circular, they recognize that gender, including transgender and sexual orientation, are factors that make students in higher education especially vulnerable to ragging. And the circular basically talks about ending all kinds of ragging and taking strict punitive measures. So what we found, again, as part of some of our studies, is most colleges and universities know there is an anti-ragging policy. They may even have the original anti-ragging policy printed out and stuck on their notice board, but people don't know or don't care about this 2016 amendment. So some of this information really needs to be disseminated to a wider audience. So that's something I wanted to share. Please go on. Yeah.
All right, sir. So no, I was just thinking about the same thing, that yes, it is such a high time that we educate our students, our children, about how important that we know about all the community, and we should not, it shouldn't be exclusive of other communities, should include everything. And like you said, getting it on a curriculum would be the best thing for all of us.
Right.
So having said that, we have also you have also spoken earlier that there are many people from the community that are facing a hard time because maybe they had left home, and now because of the quarantine and the whole scenario they have to come to their home because they have no other place to go and such on, and maybe they are facing a hard time, be it from in respect to domestic violence or mentally some harassment. So would you like to tell us something about it, or any NGO or any platform or any organization there where they can find support at this time?
Yeah, good question. I think there are a lot of organizations around the country, including domestic violence shelters. Some of the domestic violence shelters, which are intended for women facing domestic violence, are also open-minded and open to housing people, lesbians and bisexual women and trans men who face these problems. So there are such shelters in Delhi and Bangalore and Chennai, and I think possibly also in Kolkata. But unfortunately, most of these resources are concentrated in the metro cities. But one can Google and find LGBTIQ groups and reach out for help in terms of people who want help. And I'll post a link here in the chat to certain groups and certain helpline numbers that one could look at. That's one thing to do. Also, people are mobilizing resources, especially for the transgender people who have been facing financial distress. So there is an international body called the Global Fund to Fight AIDS, Tuberculosis and Malaria. That's GFATM. Okay. So they have recently sanctioned, they mostly fund work against HIV, AIDS, tuberculosis and malaria. But a lot of the populations who are vulnerable to these diseases are other socio-economically marginalized groups, including transgender women, including women who sell sex, etc., etc. So the Global Fund has sanctioned $10 million, which is currently being distributed to people who are in financial distress. It sounds like a lot of money, but it's really just 1,500 or equivalent in rations for 5 lakh people. It's still a very small amount, and we are trying to get more for the country, but this is like one of the sources that people can tap into. As we speak, I'll post some links for organizations and support that's happening. There are also regional fundraisers like in Manipur and West Bengal and Karnataka, where if you are interested in supporting this cause, especially in terms of supporting people affected by COVID from the transgender community, there are places you can donate to. So,
of course, and I'm sure all those who want to contribute to the cause can find the link in the chat box, of course.
Yeah.
All right, sir. Next up, before we start taking questions live from the audience, there is a short video that I would like Ritik to play. It's on the domain SHARP NGO has been working on. So let's have a look.
दर्द करता था और आंखों में से पानी भी आता था, पर शार्प एनजीओ और ओलंपिक्स ने मेरे मुश्किल को हल कर दिया।
5 तरीके के पोषक तत्व होते हैं जो अभी खाने में आपको मिलते हैं। पहला वो बोलते हैं कार्बोहाइड्रेट्स।
ऐसे कार्यक्रमों का स्वागत करती हूँ और आशा करती हूँ कि शार्प एनजीओ ऐसे कार्यक्रमों को आगे प्रोत्साहित करता रहेगा, जिससे बच्चों में एक जागरूकता बनी रहेगी।
So yeah, that was a very short video, I would say, from SHARP and everything that we have been doing so far. So next up, let's take some questions from the audience as well. Okay, I don't know if we can get this attendee, but it's an interesting question, and I would simply not want to just dismiss it. The question is the question says, at first, it appreciates such an informative session. And then the person continues, how do you think Indian citizens in remote areas can be educated in this sensitive issue?
Okay. It's a good question again. I would say that LGBTIQ people are everywhere. Though many of them do migrate to the cities for job opportunities and to get away from their families. The communities are everywhere, and even in small towns of India and villages of India, at least the Hijra community would be visible. And I think in terms of raising awareness, a lot of community groups themselves work in rural areas and are raising awareness. For example, I have a friend called Shalini, who's a trans woman who works in some villages in Tanjore district in interior Tamil Nadu. And she has found that she has been able to build rapport. She's got her mother to accept her. She's been able to build rapport with panchayat officials, with district collectors, with teachers, with a whole bunch of stakeholders. And during the COVID crisis, a lot of these people who have only received information about the community from her and who know her and who interact with her on a daily basis, supported quite a bit for the community as such marginalized because of COVID. So I think raising awareness, people being out, and I think it starts in family. If people can actually be open to their family members, that's probably the first step. It's easier said than done, and people may not have the luxury to be able to do so. So we have to look at other avenues. The one particular avenue is there is something called the National Legal Services Authority, which has the State Legal Services Authority and the district as well as taluka level legal services authority. And they are supposed to educate the public on the rights of different communities and what legal remedies are available in terms of people facing violence or human rights violations, denial of property, etc. So the National Legal Service Authority was instrumental in the Supreme Court verdict of 2014 on transgender rights. And they have a mandate, and in some states, like in Manipur that we are aware of, the state and district legal service authority have been doing a good job of going to holding informational sessions. They have paralegal volunteers, and they hold informational sessions at the local community level about laws. But when they speak about laws, they also speak about the laws impacting people from the transgender community. So that's one kind of frontline worker from the Legal Service Authority. The other avenue is the frontline health workers like the Ashas and Anganwadis and the auxiliary nurse midwives, who do need sensitization on these issues. And some sensitization has been happening in the state of Kerala, which has a really good primary care system and a lot of training and sensitization. And my colleagues have been doing similar work in the state of Odisha and in Manipur, sensitizing frontline health workers on issues of transgender and gender non-conforming children, etc. So that is another way that the information can get out to the community. So the healthcare frontline workers and the Legal Service Authority and their workers, their lawyers, as well as their paralegal workers are some of the options, apart from having this kind of content into the syllabus and bringing this, sensitizing panchayat leaders like some of the groups are doing. I think all of these are different avenues. The Supreme Court in 2018 actually mandated, like when it changed the law, to ensure that adults in consenting relationships should not be treated as criminal, actually mandated that the state and the center should disseminate this information up to the grassroots. It hasn't happened yet, but if that were to happen, that would be a great way to have the government itself be involved in this information dissemination.
Yes, all right, sir. So moving ahead with our questions, next up we have another attendee, Balan Ashokan. So would you like to unmute yourself and ask your question? Can we have Balan Ashokan, sir, please? Okay. Anyway, next step is next question from Bhavna and Lo. Bhavna, would you like to unmute yourself and ask your question, please? All right. So in that case, I'll just read out this question. It says, why do people always give away their children if they are the third genders? Should they not keep it with their original families and be educated like a normal person?
It's a good point. I just want to make a small clarification that the children who are given away are not necessarily third gender or transgender. They are actually intersex children who are born with body parts that are different from male and female, and the parents don't want to deal with it and give it away to the Hijra community, give these children away to the Hijra community. Yeah, I would say it is ethically and morally wrong, but the problem is that society is so much grounded in the binaries of male and female. The first question all the family members want to know is it the baby a boy or a girl? And all the expectations going around with the masculinity and femininity. So parents find it an embarrassment, or they may find it a shame, and they don't want to deal with the consequence of raising such a child in the household. We have seen very horrible things. We have seen infanticide, where intersex children are actually killed the same way girl children are killed in some communities. So yeah, it absolutely needs to be stopped. The Ministry of Social Justice and Empowerment has actually announced an amount of 1,000 rupees per month to parents of transgender and intersex children as an incentive to retain the child within the household and not give away the child or send the child away to an institution. But again, I think the social biases are much stronger than anything else, than principles of justice and so on.
All right.
But I agree with the respondent. They should not be giving the children away. Yeah.
Yes, and unfortunately, that has been the case with many of the children.
Yeah.
Yes. So next up, we have a question from Balan Ashokan. Can we have him? Yes. Hi, sir. Can you hear us?
Yeah. Yeah. Hi. Please go ahead. I think you muted yourself again.
Balan Ashokan, sir, you have to unmute yourself and then go ahead with your question, please.
Yeah. Hello, now you can
So
hear
where
me?
are you calling from?
Bangalore.
Would you like to introduce yourself?
Yeah, I am Dr. Balan Ashokan, employed in one of the private export company and also a social worker doing free services for Ayurvedic medicines voluntarily.
Great. So what's your question? Would you like to ask your question now?
Yeah, that's what. How are these transgender peoples protected during this pandemic, and what is the part of the youth, because they are mostly scared when they see them during their adolescence time? That was my question.
Okay. Yeah, great question. In summary, there is not a whole lot of support for the transgender community, and a lot of the traditional avenues of livelihood are no longer available, right? So some NGOs and especially organizations working in healthcare with the transgender community have been trying to mobilize some support. And I think when it comes to youth and the fear they may have, a lot of this youth, they are fed stereotypes that if you, as a child, you don't behave properly, I'm going to give you off to the Hijra community, things like that. So I think having the sex and sexuality education that Shaheen spoke about earlier in this conversation, I think is very, very important for people to understand that they are not the other, they are among us, and that they are no different from us in their humanity, and that over time can dispel the stereotypes. In terms of support, I know that there are some youth groups that have really reached out in terms of ration support and so on for trans communities during the first wave of the COVID pandemic. And I think that young people who are also from the community, from the LGBTIQ community, are mobilizing a lot of resources this time. In Chennai, a transgender kitchen has been started because Sundays have been full lockdown, and at least to have one full home cooked meal the trans community themselves are making and serving food for the community and for other people. And a few cities have these initiatives, but it really needs to expand. I have posted the link of that aggregates all the fundraisers for transgender community in the chat. It's the link from tweetindia.org. So you might be able to find out more organizations and what they're doing and how they can be supported.
That's right, sir. Thank you so much, sir, for the question, and thank you, sir, for your answer as well. So next up, we take this next question from Sujit Kumar. Mr. Kumar, can we have you? Can you just unmute yourself and ask your question, please?
Yes, good afternoon. Actually,
good afternoon,
my question
sir.
is that we talk about that we have to include everybody while we address the problem which we are seeing in the COVID situation. But what we are seeing everywhere, whether we talk about news, newspaper, whatever we see, what we hear, that people are not trying to help each other, even if the which means somewhere they are lacking the spirit. What we also see, like the schools, if we talk about, no doubt the teachers are doing a great job, but when we speak about that some students which they belong to EWS category and they don't have the resources, so somewhere we feel that the school is not helping those students and are not trying to address the problem in terms of device, in terms of the connectivity to those we can say other students. The government may be trying to do a lot of hard work in order to supply the oxygen, but still here also we see some people are that much of the money minded that they are trying to hoard the oxygen. So do you think actually the spirit of inclusivity is somewhere lacking in the present generation or the time period? Because at this time we need this actually.
Yes, thanks for the question, sir.
Yeah, Mr. Sujit Kumar, I appreciate your question. It is true that in a time of pandemic, there is a lot of panic. And when people go into panic mode, some of them try to hoard resources. And there may be some unscrupulous elements who try to make money out of other people's suffering. But I still have a firm belief and faith in the goodness of humanity. I know that a lot of things the government is supposed to do, but is not able to do. I mean, there's a whole constraint of resources and scale in addition to everything else. And I think this is the point where civil society organizations like SHARP and other groups are stepping in some ways. I have seen a lot of, during the first wave, a lot of social networks, people were reaching out to middle-class folks in cities and asking for donations of smartphones that were not being used. So I know there have been drives where people have connected people with smartphones that they wanted to give away to children who are from economically weaker sections, so that they would have that access. So some of it is happening, and I think we need to have a lot more of it happen. So yeah, would you like to add something, Shaheen, from your side? Yeah.
So that's what I feel personally as well, being an active listener of this session as well. What I have learned so far is we need a long way to go. We indeed have a long way to go, and we definitely, like you said, sir, yes, we have done and we have accepted a lot of things, but we need to acknowledge the fact that yes, we need more things to come in our way. With that, sir, I would like to take. Thank you, sir. So with that, I would like to take this next question from Ms. Shikha. Ms. Shikha, can you unmute yourself, please, and ask your question? Also, would you like to tell us where you have joined in from? Yes, Ms. Shikha. Okay. So in that case, I would just like to ask a question.
She's saying she's unable to unmute herself is what Shikha has messaged, but I think now she has unmuted herself.
Yes.
Shikha, go ahead.
Am I audible?
Yes, Shikha. Yes, you are.
Okay.
Shikha, please ask your question. And also, would you like to tell us where you are from?
Yeah, sure. Thank you. I'm from Delhi. So my question is about LGBTQ community employmentability. I mean, there are so many suffering about unemployment for the youth of our nation. How we can, solve this whole scenario where we cannot give the employment for our own youth. So the marginalized section of the nation, which is LGBTQI. So how would you answer this?
Yeah, I would probably make say that there's no distinction between our own youth and other youth like LGBTIQ youth, because LGBTIQ youth are also part of our families. But your point is well taken. I think there are long-term, medium-term, and short-term solutions. I think the long-term solution goes back to education, making sure that gender, sex, sexuality is not something that educators in schools shy away from, that children grow up with a healthy regard and acknowledgement of diversity, that in the long term makes helps us to ensure that LGBTIQ children are not discriminated, are able to complete their school and their college and have access to jobs. So that's the long-term solution. In the short-term solution, granted that there are a lot of individuals now who have gone past the stage where they can go back and complete school or get a formal education. One has to look at other kinds of livelihood opportunities. And there are some initiatives in this regard. For example, UNDP India recently did a mapping of skills and competencies of transgender people in some districts of Odisha and Tamil Nadu. And the idea is to see if they can be linked up to existing skill development training programs. And if not, should new training programs be organized. And recently also in Tamil Nadu, through the Tamil Nadu AIDS Control Society, nearly 30 transgender people were provided skills and placement in different fields. So I think that there is a huge livelihood and skill building vertical in India, in the private sector and largely in the public sector as well. We just have to make sure that people from the LGBTIQ communities are able to attend these courses. When we have approached some of these training institutions, they said, okay, we can organize a training if you bring 30 transgender people. But having a specialized training just for 30 transgender people where they have no opportunity to mix with other students also does not kind of serve the purpose. The best way is to integrate and mainstream diverse students with the mainstream student body and make sure that people are able to access whether it's education or vocational training. But there is one organization called Periphery, P-E-R-I, F-E-R-R-Y, which is the only organization in India that I know of that is focused specifically on skill building and placement for the transgender community in India. So you can Google them and reach out to them. And they are doing some great work in terms of employability in various sectors, whether it's people just who have very limited formal education to people who are software engineers but are not able to get a job because they are transgender. So there are some resources and some organizations working in this regard. But the long-term solution, of course, is making sure that such children are not marginalized at all, right from the school days. Yes. Thank you, Shika. Yes.
That's right. So, and personally, even I feel there should be more organizations like Periphery who will come up with providing skill training and to the community. Yes, that's right. So next up, we have another question from Raksha Jaiswal. Raksha, if you could just unmute yourself and ask your question. Tell us where are you from? Yes, can we please have Raksha?
Good evening, ma'am. Good evening, everybody.
Good evening,
I just want to know about the courses or some places from where the transgenders can get the training. But half of my answer was given by sir just before that. And I just want to ask that, is there any special reservation for the transgenders in such type of special courses in universities, either government or private universities?
Right.
So that they can have their own startups and
Thank you again. That's a very good question. Actually, in summary, the answer is no. It's just in very, very few states. Like there are reservations for transgender people in Kerala. There are reservations in Tamil Nadu. I'm not sure of other states that have reservation, but the Supreme Court in 2014, in the verdict, which is called the Nalsa verdict, actually mandated that transgender people should be considered socially and economically backward classes and should be eligible for reservations in education and employment. But that has not translated into action in reality, except in a couple of states. If you want the other part of your question, which was partially answered about skill building institutions, I have typed my email address in the chat box, so feel free to reach out to me, and knowing where you are, if you have some specific queries for your part of the country or your city, we can try and find out. There are organizations that are doing this kind of work and linking up people to skill building programs specifically for the trans community.
Yes.
Thank you.
Right.
Thank you, sir.
Thank
Thanks a lot, sir.
Thank you so much, ma'am, for your question. And in fact, like Raksha was telling, so many questions have already been addressed by you, sir, while you were talking about the things. And yes. Next up, we have Anjali.
Hello.
Yes, Anjali, would you like to ask your question and tell us where are you from? Yes.
Yes, ma'am. Good evening, ma'am. Good evening, sir.
Good evening.
I'm from Chandrapur district, from Aditya Birla Public School. Sir, I would like to just know that due to this severe pandemic, many of the students, many of the parents, either they have lost their beloveds, or either they have lost the parents, or either they have lost the children. So in that case, they don't have any helping hand for them for the survival. So is there any source of, is there any source for them so that they can be away from the stressful life and get involved into the routine life? Could you please help me out, sir?
Yeah, so I'm assuming your question is not specifically about LGBTIQ community, but children in general who are destitute or who have lost their parents. I need to find out. I don't have the answers off the top of my head, but do you have any suggestions, Shaheen? I'm putting the ball in your court.
Yes, sir. And obviously, Anjali, you can find all your answers. Like your answers will be addressed through our email addresses as well. Those you can always leave your question in the chat box, and we will try to get in touch with you as in every possible way we can.
Thank you, ma'am. Thank you, sir.
Meanwhile, I'll request Ritik to play a video from SHARP. A short message of hope, maybe. Yes. Ritik, can we play? Can we have a video?
They long recognize the anxiety is very, very normal, very, very healthy function that alerts us to threats and help us take measures to protect ourselves. Our anxiety is the thing that helps us to make the decisions that we need to do right now. Like in this pandemic, we are anxious what is going to happen to our health to our family members or our peer groups. So what we are doing, we are observing the government guidelines, we are observing this, we are wearing masks, we are sanitizing our hands and things like that. So not only we are protecting ourselves, we are protecting others also. So anxiety in a way is a plus sign with respect to how we are going to behave in a crisis situation. So we have to make sure that we are having reliable resources of knowledge. It can be from the sites of UNICEF, from the WHO or Ministry of Health and Family Welfare, and those information only should be shared with others. This is matched to the adolescent, our students. They should also keep in mind that illnesses due to COVID-19 infection is generally mild with respect to the adolescent and young adults. So many of the symptoms of COVID-19 can be treated. So the responsibility lies with the adolescents. They have to tell their parents or trusted adult that we are not feeling well, and if they tell these things to their families, then they are going to take care of their health issues. So there are many effective things that we can do, that we are through the government guideline that is available in this reliable sources. So we can observe many things that is being provided by the government. We can observe those safety measures, and we can protect ourselves in the times of pandemic, be it at our home or when the school reopens. Basically, we should make an analogy of our lives with the tree. Like trees have three important aspects, like roots. These are invisible, but they should be very, very strong. The trunks, they are visible, but it should also be strong so that it can withstand the storms and things like that. Then this crown, corona, this crown is the giving back to the society, the fruits and leaves and things like that. Similarly, in our life, there should be spirituality, there should be compassion for others. Like trunks, we should not give our remote of our happiness and sadness in the hands of others. There should be control with respect to that. And crown, the serving others, the contribution back to the society.
Yes. Thank you so much for that video. So you're on mute, sir.
Okay.
Yeah, so that happens with me as well. Anyway, that was a good that was such a good message from Mr. Ashish Kumar. Next up, so as a closure to this whole segment, I would say such an awareing session for all of us indeed. So would you just give a short closure to this entire segment, sir?
Yeah, thank you again, Shaheen and SHARP NGO for the opportunity. And I'm really impressed that there's over 150 participants here who have stayed on for the session to listen to some of the thoughts and facts around inclusion of the LGBTIQA community. And this is again something that gives us a lot of hope. I understand that we were probably not able to answer all the questions in the limited time, and some of the questions require more thought and more research, for example, in which town, which training program is available. So we'll definitely try to get back to you all. I think that it's definitely a time when we are all discouraged and feeling low because we open the TV, we open our phones, and we just see videos of hospital beds and people not getting oxygen. And many of us have had our own family members fall sick or have lost friends and colleagues and family members. So I think we need to keep our hopes up, and it's probably a sobering reminder that we are not that different. Yes, we may be of different religions, different classes, different sexual orientations, different genders, but we all depend on the same oxygen. We all depend on the same, support and faith in humanity to keep ourselves alive and sustain ourselves. And we also saw many inspiring stories of people of one religion who performed the funeral rites for people of another religion. And, there are things like that that really give us hope. And I think a pandemic is a situation where we hopefully will have some time to reflect on the transient nature of life and health, and kind of renew our resolution to be supportive to each other, whether it is through a formal NGO like SHARP or Sati, or in any other way as a well-wisher, as a teacher, as just a member of society. So I'm really happy to have had this opportunity to speak with all of you all. And if you want to know more about the LGBTIQ community in particular, feel free to reach out to me and I'll be happy to reply. Just give me a couple of days to get back to the mail. Yeah.
Definitely. Thank you so much, sir. That was indeed a great session with you, and it has been an honor to share the screen with you, sir, and for sharing all the thoughts and experiences. It was a big thank you to you, sir.
Thank you.
Also, before we end the segment, we also have another video that's coming up. It's a video from SHARP, an initiative for the women that we took. Yeah. Here's the video.
गर्भवती औरतों, किशोरियों और बच्चों के विकास के लिए योगदान डाल रही हूँ।
इस संस्था में रहकर मुझे काफी कुछ सीखने का मौका मिला है। धन्यवाद।
So yes, that was a short video from SHARP celebrating womanhood. And these were some of the programs that SHARP has organized in the past in the course of time. So moving ahead, it's a closure from me. And yeah, that was the last segment from in terms to communicative talk, but not having said that, there is another segment that is coming up, and trust me when I tell you this, this would be the star of all the series that we have had so far. So please stay tuned.
Thank you
Yes,
so much,
Shivani, over to you.
Thank you so much, Shaki. Okay, so as we all know, this is our self-enriching and fun session. So we are going to start within a minute. So can we have all the artists for audio video test? Mr. Phoenix, can you hear me?
Hello.
Hello.
Hello. Can you hear me? Hello.
Yes, I can hear you, but I cannot see you.
Just a sec.
Yeah.
Yeah. Can you see me now?
Yes, I can see you. Thank
How
you
come
so
I'm
much.
not able to see myself on the screen?
I hope it's fine now.
Okay, I'm not able to see myself on the screen. Anyway, it's fine. You can see me, right?
Yeah, we can see you. So,
Okay.
Oh, thank you. Anjali, are you there? Can we have a little audio and video test? Anjali, can you hear me? Okay, so we have Tanya also. Tanya, do you want an audio video test?
Yeah, can you hear me all right?
Yeah, I can hear you, and we all can hear you right from the beginning.
Yeah.
So thank you so
And
much.
Mr. Phoenix, I think it was because the screen was being shared that you were not able to see yourself. I think you should.
Yes. Now I am able to see. Yeah.
Perfect. All right.
Yes.
Looking forward to your performance.
Looking forward to performing also. So I'll switch off this Bluetooth thing, and you can see whether the sound is proper or not. I'll just play and show. Is it fine?
Yes. It's totally fine. Okay. So Anjali, are you there? Anjali and Omkar? Anjali? Mr. Phoenix?
Yeah.
We are. I'll first invite you, and then you can. Then we can have your performance.
Yeah. I was just saying if the sound is audible properly for you. Okay.
It's perfect.
Okay. Cool.
Hi Nilima, can you hear me?
Yes, ma'am.
आप ठीक अपने कैमरा पे आ सकते हैं एक बार? Okay, thank you so much, Nilima. Thank you. So, good evening, everyone. A warm and a humble welcome once again to our marathon of webinar, Avalamb. So, my name is Shivani, and I will be I will be hosting this session for you today. A brief introduction about SHARP NGO. SHARP stands for School Health Annual Report Program. It's a pan-India non-governmental health organization working from over 22 years in the field of holistic development and healthcare of students and community. So about a little brief about Avalamb also. It's a national level campaign by SHARP NGO to raise hope, to give you some support during the time of pandemic. So this marathon of webinar by SHARP will come out one such platform where you will be more aware and you enjoy more activities. And just give me a second. Okay, so as you all love Avalamb so much that now we have organized entertainment evening for all of you, as this will be our last segment, and we hope you love it, you enjoy it, and you enjoy it to the fullest. So we have some amazing performances from renowned artists all over India. So without taking much of your time, I would like to invite our first artist, Mr. Phoenix. He is a violinist, composer, soloist who have performed concert all across India with fusion and tapasya and laya, fusion band tapasya and laya. And he has his own fusion band called Conversion. Mr. Phoenix has performed with renowned drummer for MTV Unplugged and Amit Tiwari and Amit Trivedi for MTV and even in Youth Commonwealth Game. We are so honored to have you and eagerly waiting for your performance. Over to you.
Thank you so much. Thank you so much. Thank you.
Thanks to you, Mr. Phoenix. I can
Thank you.
see
Thank
the
you so much.
comment, I can see the chat box. It flooded with messages like, oh my god, amazing, beautiful. It was so soothing, so
It was an
relaxing.
honor.
It was so, I mean, it's our honor to hear you live. Thank you so much for your
No problem.
performance.
It's my honor to perform for you all. Thank you so much. Thank
It
you.
was
I'm glad
so,
you all like this.
thank you, thank you. You can see
Thank
the
you.
chat box. You can see the chat box.
I'll do it. I'm seeing it. I'm actually seeing it. Thank you so much.
Thank you so
Thank
much.
you. Thank you.
Thank you. Okay, so let me invite our next artist. We have with us Mr. Omkar Dhumal. He is a Hindustani classical Shanai player, multi-instrumentalist, composer, performer, and a seasoned artist. Mr. Omkar has been active in Indian music instruments since a decade, and he has worked widely spread in India and Bollywood as well. And he has also worked with eminent musicians like A.R. Rahman, Amit Trivedi, Nuclear, Sachin Jigar, to name a few. So glad to have you. Eagerly waiting for all of your performances.
Hello. Namaste.
Hello.
Hello.
Yes, you can go ahead.
Okay.
आप start कर सकते हैं.
Yes. So the first track which I'm playing is called Breeze. ये मैं Irish whistle पे बजाने वाला हूँ. Please enjoy the track. So the next track which I'm going to play it's called Breeze.
Omkar, till you start, can I tell you something? Hello? Hello? I think they can't hear me.
So this was the original track which I have composed on Shehnai. Basically, Shehnai is an Indian traditional instrument, and भारत के सभी प्रांतों में आपको ये देखने मिलेगा शहनाई. इसको एक नया रूप, इसके साउंड में एक नया रूप देने की कोशिश की है. पारंपरिक शहनाई में कुछ 2 पंक्तियां सुना दो. पारंपरिक शहनाई को एक उच्च स्थान लाने में उस्ताद बिस्मिल्लाह खान जी का बहुत बड़ा हाथ था। वैसे शहनाई मेन स्ट्रीम इंस्ट्रूमेंट नहीं था, बट उस्ताद बिस्मिल्लाह खान जी ने उसे वो मुकाम पर लेके आए और बहुत सक्सेसफुल रहे वो। तो ये आज जो भी मैंने ट्रैक्स बजाए वो मैंने मेरे गुरुओं को श्री मधुकर धुमाल और पंडित अरुण कशालकर जी, उनको डेडिकेट करता हूँ। और आप सबको एक सूचना देते हुए कि मास्क पहनना, आप दूरी रखना और सभी सेफ्टी प्रिकॉशन के ध्यान रखना। थैंक यू सो मच।
ओमकार, कैन यू हेयर मी नाउ? मैं पहले भी कुछ बोलना चाहती थी बट आई थिंक आप सुन नहीं पा रहे थे।
नहीं।
तो मैं ये बोलना चाहती थी दैट आपका जो फर्स्ट सेगमेंट था, आई वाज लिटरली डांसिंग बिहाइंड माय कैमरास। इट वाज सो गुड, इट वाज सो गुड। मैं सच में डांस कर रही थी, दैट मैं खड़ी हो गई एंड आई वाज सो एंजॉयिंग ईच एंड एवरी बिट ऑफ इट। एंड आई थिंक यू कैन सी इन द चैट बॉक्स, जैसे कि मैं फिनिक्स को भी बोला कि सब लोग इतना एंजॉय कर रहे हैं आपके परफॉर्मेंसेस। लाइक फुल डे का पूरा हम रिलैक्स हो गए हैं मेंटली, इमोशनली। So thank you so much. And
thank
anyone
you so much
from the audience, कोई हमारे आर्टिस्ट से इंटरेक्ट करना चाहता हो तो you can raise your hand. तो आप ऑडियंस हमारे आर्टिस्ट से इंटरेक्ट भी कर सकते हैं। So Omkar, if you allow, we can have some audience as well.
Yes.
Thank you. So ज्योति आर्या।
Yes ma'am.
आपको कुछ कहना है? कुछ पूछना?
Yes ma'am, ने बहुत अच्छा परफॉर्मेंस किया।
Thank you.
Okay sir.
Thank you. Radhika. Hi Radhika. Hello Radhika. Can you hear me? Please unmute yourself. I think there must be some technical glitch. But मैं सब ऑडियंस की तरफ से मैं बोलना चाहूंगी कि बहुत अच्छा लगा, बहुत मजा आया।
Thank you so much.
और जैसे आप शहनाई को पूरा वर्ल्ड वाइड लेके जा रहे हैं, सो गुड टू सी, सो गुड टू हेयर, एंड आप बिल्कुल अपनी परफॉर्मेंस में थे। इट वाज सो गुड। थैंक यू सो मच।
Thank you so much.
Thank you. Okay. So with so many singing performances, we have one dance performance by Nilima, and she will be dancing live for us today. And so I welcome Nilima, eagerly waiting for your performance as well.
Good evening.
Yes Nilima, आप start कर सकते हैं। प्रतिमा, कितना ग्रेसफुली आपने डांस किया. मैं अपनी मतलब स्क्रीन से अपनी आंखें नहीं हटा पा रही थी और सब इतना अप्रिशिएट कर रहे हैं आपको. ग्रेट परफॉर्मेंस, सो ग्रेसफुल एंड थैंक यू सो मच. सो स्वीट ऑफ यू. आपने परफॉर्म किया एक ग्लोबल कॉज के लिए. थैंक यू सो मच. बहुत अच्छा लगा, बहुत मजा आया.
Thank you.
थैंक यू. So now I invite our next performance, Umesh Vardhovan. He is a percussionist, tabla artist, learning tabla from the age of 11. He has also played in the recording of Hindi, Marathi movies and commercials. He has performed on so many different Indian prestigious festivals with all around and across so many different Bollywood singers in various concert performance. So I welcome you, Umesh. Over to you.
I will be performing some guitar. Can you hear me?
Yes. Can you be a little loud if possible? Thoda sa.
Loud now. So I'll be performing some teen tal, and my instrument is called cajon. It's a Spanish instrument from Peru. Like they play with the flamenco, but I will be playing some traditional stuff from India, tabla things. So I'll start. We talk later after I finish. Will I start?
Yes, you can. Please go. Please. We are waiting for your performance.
Thank you very much. Hello?
I mean, I'm speechless now. I don't have any words.
Hello?
Can you hear me, Umesh?
Can you hear me?
Hello, can you hear me? क्या आप मेरे को सुन सकते हैं? Yeah, I can hear you. I hope you can hear me. I think there's some network issue. Hello? उमेश, क्या आप मेरे को सुन सकते हैं?
Yeah.
Okay. So first of all,
I can hear.
Okay. So first of all, I am speechless. मेरे पास words नहीं है कि इस performance के बाद मुझे क्या बोलना चाहिए. I mean,
मेरे
those
पास भी नहीं थे
beats,
जब मेरे गुरुजी ने मुझे सिखाया.
I mean, वो beats और जो energy, हम अब वो energy feel कर सकते हैं. And it was, I mean, as I said, मेरे पास words नहीं हैं. And we are honored to have all these performances, honored to have you. Thank you so much for coming to this event, Avalamb. Thank you so much.
Thanks.
Okay, so audience, I hope you all are enjoying. आप सबको मजा आ रहा है? Because we still have performances for all of you. हमारे पास अभी भी performances हैं. So keep waiting. Okay, so now I invite Miss Anjali Joshi. Anjali is a biotech student turned singer, songwriter. She has performed folk, Western music all across India and abroad and won many international and national awards. Anjali has been an active street performer to promote folk music and working towards reviving the folk song and creating independent music. So, pleased to have you. Over to you, Anjali. Hello.
Hello. Hi.
Hi, Anjali.
Hi, Shivani. Thank you for having me today, and we are honored to perform with you. So, आज आपके सामने mostly folk songs present करने वाले हैं. मेरे साथ मेरे friend है अभिषेक, who is accompanying me on guitar.
Welcome,
And
Abhishek, as well.
we have a rich tradition of folk music in India. तो शुरू करते हैं एक कबीर भजन से,
Sure.
जो कि एक मालवी folk है. And in this song, Kabir invites us to visit a very beautiful place, and which is not very far away from us. It's within us. It's inside us. So he invites us to visit this beautiful palace inside our mind, inside our body. And the song is called Thara Rang Mahal. It says, Thara Rang Mahal में अजब शहर में आजा रे हंसा भाई निर्गुण राजा की सिरगुण सेज बिछाई. तो शुरू करते हैं. आप भी जहां पर भी हैं प्लीज हमें ज्वाइन करिएगा. अजब शहर में आजा रे हंसा भाई निर्गुण राजा पे सिरगुण सेज बिछाई सिरगुण सेज बिछाई. रंग महल में अजब शहर में आजा रे हंसा भाई निर्गुण राजा पे सिरगुण सेज बिछाई सिरगुन सेज बिछाई। अरे हरे भाई इना देवलिया में देव नहीं, झलर कुठे गरज कसी। अरे हरे भाई इना मंदरिया में देव नहीं, झलर कुठे गरज कसी। हरा रंग महल में अजब शहर में, आजा रे हंसा भाई निर्गुण राजा पे सिरगुन सेज बिछाई। सिरगुन सेज बिछाई। ओ, अरे हरे भाई बेहद की तो गम नहीं, नुगुर से सिन कसी। अरे हरे भाई बेहद की तो गम नहीं, नुगुर से सिन कसी। हरा रंग महल में अजब शहर में, आजा रे हंसा भाई निर्गुण राजा पे सिरगुन सेज बिछाई। सिरगुन सेज बिछाई। अरे हरे भाई कहे कबीर विचार से न माही से न मिली। अरे हरे भाई कहे कबीर विचार से न माही से न मिली। हरा रंग महल में अजब शहर में, आजा रे हंसा भाई निर्गुण राजा पे सिरगुन सेज बिछाई। सिरगुन सेज बिछाई। सिरगुन सेज बिछाई। So the next song is a Rajasthani folk song. I've spent a significant period of my life in Rajasthan. So it's the language and culture of Rajasthan. The song is called Wari Jaun Re, Balihari Jaun Re. Mhara Satguru आंगन आया, मैं वारी जाऊं रे. So एक disciple अपने teacher के घर आने पर इतना आनंदित है that he or she, they are singing the song for him. So yes, here we go. वारी जाऊं रे हो बलिहारी जाऊं रे, वारी जाऊं रे हो बलिहारी जाऊं रे. हमारा सतगुरु आंगन आया, मैं वारी जाऊं रे. हमारा सतगुरु आंगन आया, मैं वारी जाऊं रे. वारी जाऊं रे हो बलिहारी जाऊं रे, वारी जाऊं रे हो बलिहारी जाऊं रे. हमारा सतगुरु आंगन आया, मैं वारी जाऊं रे. हमारा सतगुरु आंगन आया, मैं वारी जाऊं रे. सतगुरु आंगन आया जी आया, हो गंगा गोमती लाया. सतगुरु आंगन आया जी आया, सतगुरु आंगन आया जी आया, हो गंगा गोमती लाया. हमारी निर्मल हो गई काया, मैं वारी जाऊं रे. हमारी निर्मल हो गई काया, मैं वारी जाऊं रे. वारी जाऊं रे हो बलिहारी जाऊं रे, वारी जाऊं रे हो बलिहारी जाऊं रे. हमारा सतगुरु आंगन आया मैं वारी जाऊं रे, हमारा सतगुरु आंगन आया मैं वारी जाऊं रे। हो सतगुरु दर्शन दीन्हा रे दीन्हा, सतगुरु दर्शन दीन्हा रे दीन्हा, हमारा भागोदय कर देना, सतगुरु दर्शन देना रे देना, हमारा भागोदय कर देना, हमारी निर्मल हो गई काया मैं वारी जाऊं रे, हमारा भरम वरम सब छीना मैं वारी जाऊं रे, वारी जाऊं रे, हो बलिहारी जाऊं रे, वारी जाऊं रे, बलिहारी जाऊं रे, हमारा सतगुरु आंगन आया मैं वारी जाऊं रे, हमारा सतगुरु आंगन आया मैं वारी जाऊं रे, हाय मैं वारी जाऊं रे, हाय मैं वारी जाऊं रे। अब जो अगला गाना है, it's a very ecstatic song. It's about joy of life, supreme joy, supreme bliss. कबीर ने कहा है मन मस्त हुआ फिर क्या बोले. So he's so full with happiness and satisfaction and joy that he doesn't have anything to say. Nothing can describe it in words. But still he has described it in words and it's beautiful. So please enjoy and join with us with clap or tap or anything. The words are man mast hua phir kya bole phir kya bole. ये जी बदरा उठा प्रेम का, ये जी बदरा उठा प्रेम का, हम पर बरसा होई अजी सीली हो गई आत्मा और हरी भरी बन राए। मस्त हुआ फिर क्या बोले। So that's all for today.
अंजलि that's all. ये क्यों बोला आपने? हमें बहुत मजा आ रहा था. आप क्यों रुक गए यार?
I can't hear you. Just a minute.
Sure.
No, I can't.
Hello, Anjali, can you hear me now?
Yes, now I can. I'm so sorry.
Okay, so I was saying कि आप क्यों रुके? इतना मजा आ रहा था, मन सच में बहुत ज्यादा ही मस्त हो गया. आपकी परफॉर्मेंस है. You are so beautiful and how graceful you were singing. कितना मजा आ रहा था. हम बहुत enjoy कर
Thank
रहे
you
थे.
so much.
Thank you so much for coming.
Thank you so much for inviting us.
Thank you once
Thank you so much,
again.
ma'am.
बहुत मजा आ रहा था. Till then you can read our chat. आप हमारी
sure.
chat देख लो एक बार कि I mean it's flooded with so many messages for you and for other artists as well. So thank you so much. Honored to have you all.
My
Thank
pleasure.
you.
Thank you so much.
So now I invite our last but not the least performance artist, Tanya Sharma. So Tanya is an Indian musician currently based in Canada and explored vocal performances in theatre, French choir and Sufi music. Upon traveling around the world, she decided to produce her own music, and her musical project, Tanasha, is born out of vision to explore sounds that seamlessly blend dark, down-tempo, electronic music with interesting vocal and lyrics. So, over to you, Tanya. पहले moderator
Thank you
और
so
अब
much.
हमारे artist. So, thank you so much. Thanks to you.
Thank you so much for having me. I hope you can hear me okay. And
Yes.
piano you can hear?
Yes, we can hear. Perfect.
Okay, perfect. Thank you so much for having me. मेरे लिए बहुत बड़ी बात है इतने काबिल और माहिर आर्टिस्ट के साथ ये मंच को वर्चुअल मंच को शेयर करना. एंड तानाशाह जो मेरा प्रोजेक्ट है उसमें मैं अपना खुद का म्यूजिक प्रोड्यूस करती हूँ इलेक्ट्रॉनिक डाउन टेम्पो. पर आज मैंने सोचा कि क्यों ना मैं वो डार्क म्यूजिक की बजाय कुछ वोकल परफॉर्मेंस करके सुनाऊँ आप सबको. तो आई एम गोइंग टू बी परफॉर्मिंग इन इंग्लिश एज वेल एज हिंदी. The first song is a request from a very special person, my mother. And ये वो पहला song है जो I think मैंने गाया था प्रॉपरली जैसे परफॉर्म करा था. तो और उसके अंदर एक बहुत होपफुल मैसेज है. तो गाने का नाम है समवेयर ओवर द रेनबो. एंड इसके अंदर एक बहुत उम्मीद है. एंड आई होप कि somewhere over the rainbow हमको भी after this crisis is over and how as things develop and get better we can also fly high and जो हमारे सपने हमारे dreams है हम उनको पूरा कर सकते हैं. So I'm going to start the performance. There's a land that I heard of once in a lullaby. Somewhere over the rainbow, skies are blue, and the dreams that you dare to dream really do come true. Someday I'll wish upon a star and wake up where the clouds are far behind me, where troubles melt like lemon drops away above the chimney tops. That's where you why can't I? If happy little bluebirds fly beyond the rainbow, why, oh, why can't Thank you, everyone. So that was my first song. And same, to continue on that note of hope and joy, I'm going to sing this other song जो मुझे बहुत पसंद है, and hope you like it. अभी मुझ में कहीं बाकी थोड़ी सी है जिंदगी, जगी धड़कन नहीं, जाना जिंदा हूँ मैं तो अभी। कुछ ऐसी लगन इस लम्हे में है, ये लम्हा कहाँ था मेरा, अब है सामने इसे छू लूं जरा, मर जाऊं या जी लूं जरा, खुशियाँ चूम लूं या रो लूं जरा, मर जाऊं या जी लूं जरा, मर जाऊं या जी लूं जरा, मर जाऊं या जी लूं जरा। So, last if there is time, I would like to sing one more song, but I understand if you have to continue with the program. Okay, I'll go ahead with it. So वो थोड़ा heavy song था actually। ये ऐसा song है जो मतलब मैं रोए बिना शायद सुन नहीं सकती सोनू निगम की आवाज में जो है, तो थोड़ा मूड लाइट करने के लिए I'll play another song। I hope गिटार की आवाज आ रही है, थोड़ा माइक दूर है।
Yes, Tanya, we can hear.
Okay, thank you. और मनवा तू तो बावरा है, तू ही जाने तू क्या सोचता है, तू ही जाने तू क्या सोचता है बावरे, जो दिखाई सपने तूने सोत जाग की, जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद, जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद, कैसे मैं कहूँ देख ना सकूं अनजाने रास्ते, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, धीमे बोले कोई एक तारा धी है कोई एक तारा गूंजा सा है कोई एक तारा सुन रही हूँ सुध बुध खो के कोई मैं कहानी पूरी कहानी है क्या किसे है पता मैं तो किसी की होके ये भी न जानी रुत है ये दो पल की या रहेगी सदा किसे है पता किसे है पता जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद कैसे मैं कहूँ देख ना सकूं अनजाने रास्ते गूंजा सा है कोई एक तारा 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 धीमे बोले कोई एक तारा धीमे बोले कोई एक तारा गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा Thank you so much everyone.
तान्या हो गया अभी और नहीं है हो गया मैं सही में मैं बोल रही हूँ कि मैं कुछ बोलना ही नहीं चाहती तो कितना मजा आ रहा था आप सबकी परफॉर्मेंसेस से बहुत बहुत अच्छे नोट पे ये आपने जो ये सॉन्ग गाया हमारा इवेंट एंड हुआ है सो थैंक यू सो मच
Thank you to you
for
as
being
well.
such a wonderful moderator and such a talented singer artist. Thank you so much.
Thank you so much and thank you to you and the team जिन्होंने इतने short notice पे ये चीज create करी है इतना beautiful platform है पूरे हफ्ते से मैं देख रही हूँ the type of chats, the positivity, the enthusiasm, it's really really fabulous. ये जो जिस negativity में हम जी रहे हैं जिस uncertainty में हम जी रहे हैं उसके अंदर it is a ray of hope. So a big thank you to Team Sharp as well.
Thank you so much. Thank you. It means a lot. Thank you so much. So once again, thanks to all the artists. It was so good. It was so delight to have you all on floor. मतलब बहुत मज़ा आया सारी performances हमने बहुत ज़्यादा enjoy करी and मैं chat बार देख रही थी तो सब मतलब इतने they were enjoying so much. So thanks to all the artists, Miss Anjali, Miss Tanya, Mr. Phoenix, Mr. Umesh, Miss Nilima, and Mr. Omkar. Thank you so much once again for coming to such a global cause and performing live for Sharp and for all the audience for our event Avalamb. So thank you so much. Ritik, can we have the winners? One of the most awaited part of our webinar. Okay. So winner of our last day 6 communication talk 1 is Ms. Bani Bakshi. Expert discussion is Monica. Communication talk 2 Ms. Bhavna and self-enriching and fun activity Ms. Ashi Goswami. So congratulations to all the winner. And now I would, for ending our event, I would like to invite my whole team to come on camera. From last 2 weeks, I think हमारी audience भी पूरी team को देखना चाहती है जो backend में भी काम कर रहे हैं. So I request my whole team to please come on camera so we can have vote of thanks. And closing to such beautiful event, Avalamb.
So guys, we have Ritik. ऋतिक हमारी पूरी टीम का टेक हेड है. जब भी कोई मेल नहीं चलता है, जूम बंद हो जाता है, we go to Ritik. We have the very sweet, very lovely Ranjita ma'am. Ranjita ma'am हर चीज का वॉइस ओवर देती है. She's been translating all the webinars that we've had in Hindi so far. We have Kalpata, she's the data head of the entire team. सारे data maintenance, M&E, monitoring, evaluation और ये सारा का सारा theme conceptualize करना panel discussions के, that's Kalpata, she's a sweetheart. We have Madhuji, she's the CSR queen of SHARP. She gets our CSR heads whenever we want them. We have Smriti, जो बहुत सारी teachers स्मृति को उनकी बहुत ही sweet और lovely आवाज से जानती होंगी. Smriti is the person who we go to when we want schools to come on board, when we're having a crisis कि targets fill नहीं हो रहे हैं. That's Smriti. And we have Swati, who's the ever lovely. She's gotten all the gender panelists on board for us. And she's just an all-round hustler. अगर कोई 10 बजे online हो सकता है, that's Swati for you. We have Sahin, who's that lovely person from Assam. And even despite of all of the network errors that she's had, being in such an area where the sun goes down at 6 o'clock, she's been there for you, moderating through it all.
It's been a pleasure, Mahima.
And we have Shivani, who is the core and soul of the 5 o'clock sessions, who would not have been as fun as they've been. So from the bottom of my heart, I want to thank everybody. We also have Tuisha. She's not switched on her video, but Tuisha is the one जो हमें minute to minute social media के handles में आपको live coverage देती है. Who's been at the forefront of providing everybody information and been live throughout, and has truly been the life of the party of Avalamb. And we also have Menka ma'am and Puran sir, जिनका vision था Avalamb करना. And जब सर ने हमें last Thursday बोला कि हमें ये करना है, सबके मन में यही thought था कि नहीं हो पाएगा. And thank you, thank you sir, thank you ma'am, and just thank you to everybody.
And not to forget Mahima, we have Mahima, not to forget, we have you with us, who have, you were the one who was an expert moderator and has taught us within this short span of time. We could not have learned so much in such a short span of time from you. So a big thank you to you as well. Right, Shivani, would you like to add anything on your behalf?
Yeah, उसने सबको thank you बोल दिया, and thanks to you also, thanks to you Mahima, and to whole SHARP team, and special thanks to our audience.
Yes.
जिसकी वजह से आप सबकी वजह से ये हमारा event इतना successful हो पाया है. Thank you for being for like 6 days and 4 hours in a day, giving us your 4 hours in a day and enjoying all the activity. अगर हम थोड़ा सा भी आपको कुछ knowledge दे पाए, कुछ aware कर पाए, and कुछ de-stress कर पाए, so we are very honored, and thank you so much. Anything from my team so they can share?
I'm gonna missing. मैं बहुत miss करने वाली हूँ. So thank you so much. I enjoyed a lot. Thank you so much, everyone. Thank you all the moderators. Thank you, sir, ma'am. Thank you.
Shivani, Nidhi ma'am wants to say something. I'm just gonna
be part of this Avalamb and having faith in us. Thank you, sir, ma'am.
Hello, everyone.
Hello, Nidhi ma'am.
Hi, Nidhi ma'am.
Hello, ma'am.
Actually, मेरी थोड़ी सी छोटी सी डिमांड थी आप सबसे. शार्प से जुड़ने से पहले एक मेल से जुड़ी थी जो ऋतिक सर की आई थी. उस मेल से जुड़ने से आप सबसे जुड़े, तो ऋतिक सर का फेस जरूर देखना चाहूंगी. आपके और हमारे बीच में एक ब्रिज बने हैं.
ऋतिक सर को हम भी देखना चाहेंगे. ऋतिक सर, प्लीज कम ऑन कैमरा.
एंड द थिंग इज दिस वन, देखा जाए तो मतलब पिछले 2-3 दिन में इतनी मिस हैपनिंग सुन चुकी हूँ, लेकिन अपने आप को अगले दिन के लिए उठाने के लिए you just need a pump up, that internal pump up, you need that. So you are providing that to a whole lot of people.
Means a lot, ma'am. Means a lot.
Thank you so
much for.
लेकिन मेरी डिमांड अभी भी रह गई. मैं बहुत कुछ भी कर लो, मैं वो चीज नहीं भूलती. तो ऋतिक सर का फेस नहीं दिखा.
Ma'am, ऋतिक sir,
would you like to tell something?
I'm on camera now. You can see my face.
So
ऋतिक सर को कहना वो सबको मेल भेजते हैं ना, तो वो मेल के साथ ना अपनी फोटो भी भेज देंगे so that हम देख सके उन्हें.
थिंक ऋतिक वो शायद किसी वजह से अपनी फोटो बना रही है, but we all can see you.
I'm on camera, Shivani, right? You can see
हाँ,
me,
we
right?
all can see you. We all can see you. I think उनकी तरफ से कुछ हो सकता है, कुछ प्रॉब्लम हो रही हो. So ऋतिक, anything from your side?
Yeah, so ये अवलंब जब कॉन्सेप्ट बना लगभग 10 दिन हो गए डेवलप करे हुए. So स्टार्टिंग से अगर आज का दिन देखें, we cannot imagine कि ये कैंपेन हमने सक्सेसफुली इतने शॉर्ट स्पैन में कंप्लीट कर ली. So this is a big feat we all have achieved, and you know, अगर ये हो सकता है तो कुछ भी हम कर सकते हैं in future. We have many big things to achieve.
Best part is this one कि ऋतिक सर मेरी जिंदगी का पहला इंसान है जिन्होंने मेरे मेल का जवाब इतनी जल्दी दिया है. मतलब मेरे पास आपके हर सैटरडे सेशन होता था, तो एक सैटरडे का लिंक नहीं आया. तो मेरे एक और सर कॉलेज के हैं, वो भी आपको फॉलो करते हैं, तो उन्होंने ही मुझे बताया था शार्प एनजीओ के बारे में. तो मैंने ऋतिक सर को मेल भेजा, सर इस सैटरडे का मेरे पास लिंक नहीं आया, फ्राइडे हो गया. आई थिंक विद इन 1 आवर मेरे पास लिंक आ गया था. तो वो मेरी जिंदगी के ऐसे इंसान है जिन्होंने सबसे पहले दिन रिप्लाई करा है.
Okay, thank you so much.
Thank you so much, Hrithik sir. Thank you so much,
thank you
everyone.
thank you to all the audience जिन्होंने सातों दिन like 6 days those who have stayed with us and have helped us in making this campaign successful.
महिमा
So, thank you
मैम,
everyone.
मत रो मत, हम कहीं नहीं जा रहे. हम यहीं हैं.
No, it has really been an overwhelming experience for all of us, actually.
Exactly.
And we are going to miss this. And I mean, हम पूरा वीक हमने किया, लेकिन पता ही नहीं चला वो 6 दिन कहाँ चले गए.
Exactly.
Are going to all of you, all the event, all the segments, and I think we have Ashi, and she wants to talk. So Ashi, you can come. You can unmute yourself. Hello, Ashi. Can you hear me? Okay. So I think there's some network issue. So anything from any of other team member would like to say?
Smriti, you want to say something? Trisha.
I just want to thank everyone, like the entire team, Hrithik, Shivani, Mahima, and like everyone who was working to this idea, and especially the audience who were, you know, coming from the past 6 days. So thank you everyone, and hope to see you all for the upcoming events as well.
शिवानी मैम, एक बात और ऐड ऑन करना चाहूंगी मैं.
Sure, ma'am.
महिमा मैम का चेहरा देख के मुझे ना 2 लाइनें ऐसे मन में याद आ गई. घर में शादी होती है ना बेटी की, तो सारे फंक्शंस हो जाते हैं, सब कुछ हो जाता है, वो एंडिंग विदाई होने वाली होती है, तो बेटी के फेस पे जो एक्सप्रेशन होते हैं, महिमा मैम के फेस पे एग्जैक्टली वो एक्सप्रेशन है.
तो आई थिंक मैम, महिमा मैम को हम देख पा रहे हैं, बट यहाँ पे और जितनी लड़कियां आई थिंक वो फिर विदाई में हंसने वाली हैं, तो महिमा मैम सिर्फ रोएंगी. तो थैंक यू सो मच निधि मैम, यू हैव बीन
थैंक यू.
आप हमेशा ज्वाइन करते थे एंड हमेशा आते थे, कुछ अच्छा फीडबैक देते थे, क्वेश्चंस पूछते थे, तो थैंक यू सो मच.
थैंक यू एवरीवन. ओके मैम, थैंक यू. टेक केयर एवरीवन आल्सो.
थैंक यू. सेम टू यू मैम. थैंक यू सो मच.
Thank you.
Okay, so thank you so much. Thanks to my full team. Thank you so much. तो अब आप कैमरा पे आ गए, हमारे सारे एक्सपर्ट कैमरास पर हैं, so thank you so much. And a special thanks to, जैसे महिमा ने बोला, special thanks to sir and ma'am, जो हर इवेंट के बाद हमें आफ्टर कॉल आता है to motivate for the other day also, कि हम क्या चेंजेस कर सकते हैं, क्या लर्निंग हमने ली. तो उसके लिए सर इज हियर.
Yeah, we also have sir on camera now.
Hello.
Hello, sir. Hello.
Hi, sir.
Hello, sir.
Hello. In the end, I would like to thank my whole team who have proved to the world that nothing is impossible in these hardest times, because it is success not only for you, but for the whole SHARP community and the school community, because 22 years back we started this organization, and today it is on the world platform and so many people have joined. And holding world's first marathon webinar is a great achievement. So I must congratulate you and all the audiences who have been with us throughout these hard times. So I'm falling short of words at this moment, but I must thank all the audience as well as people all throughout the country and all those panelists, esteemed panelists who spared their valuable time, and just at a very short notice, they gave their time to not only SHARP, but to all the people who are struggling in these times of uncertainty and anxiety, to give them the hope. The program name Avalamb means support and hope. So I hope in the end कि Avalamb जो है अपना मतलब जो है उसको सार्थक सिद्ध किया, और आप सब लोगों की मैं बहुत तहे दिल से अपना शुक्रिया अदा करता हूं कि आपने अपना पैशन जो है इसमें दिखाया, जिसके कारण ये प्रोग्राम इतना सक्सेसफुल हुआ. ऑल द बेस्ट फॉर टाइम्स टू कम. थैंक यू वेरी मच.
Thank you so much, sir. Thank you so much. Words of wisdom from you. Thank you so much. And thanks to whole team and audience once again. So thank you so much. We'll see you.
प्लीज एक बार हंस के दिखाइए प्लीज, ऐसे नहीं. जाते जाते हर किसी का एक स्माइलिंग फेस दिमाग में रहना चाहिए.
थैंक यू.
मैं बहुत इमोशनल हो रही थी.
Thank you so much.
Thank you, Nidhi ma'am, once again, and thank you. So also हम सब आपको नेक्स्ट इवेंट के लिए भी इनवाइट करेंगे.